Heavenly Father, today we put on the full armor to protect us against attack. We put on the belt of truth to protect against lies and deception. We put on the breastplate of righteousness to protect our hearts from the temptations. We put the gospel of peace on our feet to walk in your light, peace, and freedom with the Holy Spirit. We rebuke anxious thoughts. We take up your shield of faith for protection to block and destroy all the darts and threats thrown at us by the enemy. We put on the helmet of salvation to cover our minds and thoughts, reminding us that we are children of a mighty King. We are forgiven, set free, saved by the blood of Jesus. We take up the sword of the Spirit, your living word, that has the power to demolish strongholds and is sharper than any double-edged sword. We come to you, Lord, in prayer daily. In Jesus' mighty name we pray. Amen. What's up, you guys? Welcome to The Imagination. I'm your host, Emma, and I'm so excited to bring back the newest podcast regular on The Imagination, certified clinical trauma professional, certified sex offender treatment provider, licensed professional counselor, founder of Survivor Support, podcast host of his own podcast and channel at John Uhler, LPC, on YouTube, father of three, husband to his high school sweetheart, survivor advocate, and someone you all heavily quested to bring back, John Uhler. In case you are new here, or in case you missed John's first episode, here is a short recap of John's many accolades and credentials. His work began over 30 years ago, and the evolution of his career path is nothing short of astounding. His education includes attending Epic Bible College, Biola University, Talbot School of Theology, and California State University in Fullerton. His work in both clinical and administrative capacities, outpatient and hospital settings, intensive day treatment settings, residential treatment programs, and in secure facilities, including over 11 years on psychology staff within the Pennsylvania Department of Corrections, where he's logged more clinical contact hours within solitary confinement than any psych staff in the entire U.S. Prior to his work with incarcerated men, he spent years working with sexual abuse survivors and treating severely emotionally disturbed adolescents in group homes and within the largest intensive residential treatment facility for troubled youth west of the Mississippi. When John is not providing professional therapy or podcasting, he serves in an advocacy role towards helping increase safety for vulnerable women and minors who are being placed in harm's way by those pushing dangerous ideologies, public policies, and legislation. The first time John was on the show, we began an epic journey into discussing the therapeutic community from a therapist perspective who works with survivors of human trafficking, ritual abuse, and mind control, and did a deep dive into triggers and programming. The second time John was on, we continued that conversation discussing programming, linguistics, healthy and unhealthy relationships, and so much more. I will have both of those episodes listed in the show notes for you guys and highly encourage you go check those out. With each episode with John, we are building a crescendo of information valuable to any survivor or advocate to learn in regards to healing. And I'm really looking forward to continuing the conversation today as John takes us further into therapeutics and discussing what to expect in the journey into healing alongside a caring and qualified therapist. We've heard nightmare stories too many times on this podcast between survivors and those who are on the front lines of healing and therapy. And John's testimony, passion, and information he is sharing with us is an absolute breath of fresh air. My hope is that you on the other end not only learn a ton of tools for your everyday life without a therapist intervention, but that if you or someone you know does need a therapist or counselor, that you also have all the tools to vet the right person to help you. Knowing what to expect and what questions to ask to get the desired income of healing is invaluable when shopping or vetting a therapist. John sets an incredible example of grace, patience, and understanding, and I feel so blessed we all get to learn from him once again today. So grab a pen and paper and take some notes as we dive deeper into some important topics for us all to learn. Before I finish introducing today's guests, a quick reminder for you guys that if you're a survivor or whistleblower who wants to share your story on the podcast or who wants to share any information privately with me, feel free to email me at imagineabetterworld2020@gmail.com. I'd also love your support on Substack, where I'm taking up journaling as an outlet for me personally to reflect on the podcast, guests, and my advocacy work. And you can subscribe to me there at www.emmacatherine.substack.com. All of my social media links are in the show notes, and I thank you all with my whole heart for all the love, support, and safety you provide to this platform and to every single guest. So you guys, without further ado, please help me in welcoming, once again, today's guest of honor, selfless man of God, voice for the voiceless, child abuse and survivor advocate, podcaster, content creator, and therapeutic warrior, the one, the only, John Uhler. John, thank you so much for being here with me again today.
Emma, thank you for all that.
You're welcome. You deserve every word. I could have written 10 more pages. So, sort of figured out how to condense a lot of information into a short synopsis. So thank you so much for being here. I'm really excited to have you back today.
It's a pleasure to be back with you.
We got so much good feedback from the last couple episodes, and so I'm really excited to keep diving deeper into this. And for people listening, you don't have to listen to the first episode. You don't have to stop here and go back and listen, but definitely go back and listen after this or even before. Really, really valuable information that John drops, and we're gonna dive a little bit deeper into that today and keep building on this awesome information that he's providing. So John, I'm going to turn it over to you and we'll have a great conversation on this. I know you have some really great information and graphics even to present today, so I'll let you lead and we'll follow along with you.
Emma, again, it's good to be with you. And I appreciate the opportunity to, as we were talking off mic, to really begin to put in systematic form something that's really been in the back of my mind as far as for survivors that have not been in counseling or are thinking about counseling or are in counseling. Really, what is that process like? So in a way to demystify it, also to help them kind of get a sense of where should things be heading and what goes on in the mind of the therapist as far as where are we heading with all this? As far as we, meaning if I'm a client, I'm working with a therapist, I'm trusting that that therapist has a sense of where we're heading. Kind of like if you go, let's say to Africa and you're doing a safari. I've never been to Africa, but let's say we do that. I'm going to trust, or like South America in the jungles in the Amazon. I've hired the guide, but I'm trusting that the guide has a sense of where we're going, that we're not just walking in circles, because there are going to be times, certainly using that analogy, that if we're in Africa, all of a sudden I start to sense danger, I'm seeing lions, or I'm seeing something that I'm thinking like, did we take a wrong turn? Why are we going suddenly off this path and down this way? Or if we're in the Amazon, it's starting to not look as safe. And therapy will kind of move in different directions, but is it moving forward? What does that look like? Are there stages? And does my tour guide or my trail master, or whatever term we want to use, a trailblazing person that we've hired, do they know how to get from here to there and what there looks like, what that looks like? And maybe it's because I've spent a fair bit of time even trying to figure me out. Now that, how do you figure yourself out? But I come out of a kind of a unique family, but fortunately, it didn't have a lot of severe overt abuse. So that's where, as we talked about before, that I didn't know, I didn't understand the extent to which you can harm someone. So I just didn't know. But what end of the pool can you drown in? So those that have gone through SRA material have been in the deepest part of the pool, MK Ultra and SRA. But you can still drown on the third step. And so for any of us that have come out of dysfunctional homes, whatever term we want to use, I usually use the term whacked out. Okay. And the key to that, the one common denominator, is you got ultimately selfish people. And selfish people are driven to cross boundaries. And so any of us that have come out of a home, it's not talking about that no home is perfect, but the question is, to what extent are the people in the home? So when we talk about a home, we're talking about the people in the home. to what extent are they reasonable, right? Do they intend the best or do they not? There's a big difference between human fault and human error versus intentional inflicting of pain. So on a scale of 1 to 10, the kinds of things we can do to someone, one would be very minor and inadvertent. The other would be with malice and forethought, very intentional. And it matters because we are made in God's image and we can sense degrees of injustice. And that's really what the counseling process is all about. Part of counseling will be about, it's the old-fashioned term, self-actualization. So I'm trying to improve myself, trying to find my purpose. So there will be people that will come into counseling that have hit that midlife point and they're not sure what they want for themselves. And so they're clarifying their goals, their values, that kind of thing. But then there will also be kind of the other half of the population of those that will pick up the phone and call a therapist. And that will be those that are suffering from, by degree, boundary violations. So really injustice. And then the question is, to what extent? So counseling is kind of one of two purposes. One is I'm not really wrestling with anything in the past. I'm just trying to figure out on a go-forward basis. The other is I'm wrestling with something in the past. And now the question is, am I aware of that? Usually we'll be aware of symptoms. There'll be indicators. And in a way, that's what we sort of talked about at the beginning of the second program, which is, how do you know? So if you're a survivor, and how do you know that you need help? And so we began to look at, and we will continue now to look at some symptoms. But the question is both, how do you know, and what then can you expect? So once you figure out, okay, I think I've got some stuff to work on, then once you find a therapist, where are we going? Meaning, what is it, just that we kind of float and the therapist will say, what I hear you saying is? So what I hear you saying is, and it's just ad infinitum ad nauseum, we're not going anywhere, really. So if you've been in therapy or are in therapy and find that things are frustrating, or if you find that you are bored, or if you find that you're not looking forward to therapy any longer, maybe because you're wondering if it's worth your while, those are good indications to kind of review what's going on. It may be that you're working with a competent therapist, and it may be that because you're normal, you're kind of putting the brakes on. Because emotional healing is kind of like surgery without anesthesia. Right? It's an opportunity to lay down, so to speak. This is a word picture, a metaphor, but it's really, you lay down on the surgery table and thus starts the process. And so it's really self-inflicted. I'm walking into a process where it's going to be painful for me, but it's a good kind of pain. It's right, no pain, no gain. And if there's an infection, the wound needs to be lanced. The Band-Aid needs to be pulled back, and we need to begin to look at that process. So it could be that the client, because they're normal, nobody likes pain. There are no genuine masochists, by the way. And I think I mentioned that the last time. If you want to find a masochist, that'd be the person that's going to go to the dentist to have a cavity filled who will opt not to have Novocaine. I haven't met that person. Okay, so none of us like pain. And that's why if a client gets to a point and they start backing off, let's say that I'm working with them, I don't view that necessarily as a negative thing. What it means is it makes them normal. Then it's worth looking at what's going on for them, because they started a process and now they're not all that keen on moving forward. So if you're in therapy, or if you've had therapy in the past and you find that it didn't go well, it didn't go anywhere, it kind of quagmired, you got stuck in the mud, so to speak, and it just kind of petered out. It may have been that a part of you put the brakes on. So it may have been that you actually had a decent therapist, Indecent meaning they had what's called a fund, F-U-N-D, a fund, a full-orbed grasp, a big grasp of knowledge, meaning they understand. So they were competent. They could get you there. You hired the right tour guide, the person that's right with the machete that's going through the brush. You hired the right person, but it got to a point where even though they evidenced that they were competent, that you began to lose trust, not because of them, but it just started to get too dark or too, as long as you stay in the foothills, it's fine. Why are we going into the tall brush? I don't know why we're going in that way. So either the client puts the brakes on, and sometimes call it self-sabotaging, or the tour guide that you hired, the coach that you hired, meaning the therapist, in a way, you can't take someone further than where you are. You can't give what you haven't got, and you can't take someone further than you've gone. And that's kind of twofold. One, if you literally haven't done your own work, and that's where I use that pool analogy, shallow end and deep end. Pain is pain. It doesn't minimize the deep end kind of pain. But if somebody starts to get in touch with, so let's say someone is not a survivor of sexual abuse, but they were raised by a narcissist. For them to have to wrestle with that and come to terms with that, a lot of people aren't willing to because it's too painful. The prospect of what the kind of pain they're going to experience, but also what it might look like on the other side is too painful. So they will back away. The majority of the clients I have are not SRA victims. They are people that are trying to figure out about their relationships. So in a way, these same principles apply. So the good news is you can have a therapist that may not be a survivor, him or herself, but as long as they understand pain, the pain of coming to terms with truth, then they will have empathy and they will know the process. They'll know the stages. And so then you do have a competent safari guide. So if you've had a negative experience before, it's either that you yourself may have stopped the process, or you had a therapist that hasn't, and this is, again, it's not a pejorative term, but, I believe we therapists, we need to practice what we preach, right? We need to have, if you have a therapist that, let's say, has 6 divorces, they may not want to be a marriage and family counselor. There comes a point, right? It's like, okay, what, physician, heal thyself. So I think there is some degree of responsibility. Secular psychology will come along and say, nope, a therapist doesn't have anything to do with it. It doesn't matter their own personal life. You can tell I come from maybe a morals perspective, moral-based, character-based perspective, Christian perspective, where, you know what, it does matter, because we bring us to the table. We bring us to that process. So you want, all things being equal, a therapist that has a fund of knowledge, meaning a content he understands, he or she, but then also has done some work themselves so that they intuitively have a sense of what direction. Because when you're at a crossroads, depending upon, let's say, someone's beginning to connect with a memory, is this the right time, right? Because depending upon what I do as a therapist, matter of fact, this past week, SRA, survivor, a part came up and mentioned that they remembered, and out came a name. And it was getting close to the end of session. That's fairly typical. But it's been a long time. It was almost a breakthrough. Now I, as a therapist, need to figure out, is this the right time for that particular client? We're heading into Christmas. This client just getting back together with family over Christmas. Is this the right time to open that up? Because it may really start to open things up prematurely in that case. So you want a therapist that has an intuitive sense of, I even thought of like a chiropractor or something, how far do we push? How much pressure are we going to apply to that? So if somebody had a negative experience, it could be that it was the therapist, that they had blind spots. So you can't take someone further than you've gone. Or it may be that they just don't know. But then, as we've talked about in the past, with the issue of multiplicity, we'll just say parts. I would say that's an either or proposition right there. And this is coming from a therapist that early in my career, I didn't believe in the concept. So I can tell you the mindset didn't make me bad. It just meant I was not going to be effective. Why? Because of my own orientation, meaning my own perspective. So if I'm a therapist and I don't believe in the phenomenon, or if I believe it's very rare, then as I'm working with someone and they're going through not just their symptoms, but they're describing certain things, which should, in my mind as a therapist, what you want with your therapist is very similar to a doctor. You're describing things, which really are symptoms, and you're hoping in their mind, they're going through a mental checklist and they're getting closer and closer to, they're kind of what's called ruling out. This could be this or this. Like you walk in, you say, "Doc, I don't feel well." Okay. Well, you're in the doctor's office. He probably could presume you're there for a reason, because people have better things to do than go to the doctor. Okay. And now the question is, are you just here for an annual checkup, for employment, or is there something wrong? You say, "You know what? I'm just not feeling well." Okay. You notice the doctor doesn't say, "Well, can you be any more general than that?" "Doc, I'm just not feeling well." Okay. The doctor, hopefully with compassion, he'll begin to start asking you questions, because you've just given a response that is actually very appropriate. You're not trying to blow smoke. Given this day and age of HMOs, he's only got about 10 minutes. That's part of the problem these days. But you gave the first attempt at describing, and then you're hoping he's going to help start to lead those questions. So every question he asks, we're going to start now, in his mind, he's thinking of the human body and all the systems of the body. And so he'll say, "Well, describe that." And you'll say, "Well, when I get up so it's either he's going to start to look at mood, or is it just this general malaise? "Well, I don't feel very well because, when I eat, it's hard for me to swallow. And I'm finding myself, I'm waking up in the middle of the night because it's like the food's coming back up." Okay. So you notice it started with that general, "I don't feel very well." But then as the doctor is beginning to ask questions, now he's helping elicit from me information that is helping him begin to zero in on things. If a therapist, if in the back of his mind, his or her mind, so we have a mental Rolodex. Nobody has a Rolodex these days. That's funny. Some people have to actually look up on the internet what a Rolodex is. It shows you I am getting a little older. It used to be, prior to computers, they would have this, the reason they called it Rolodex, little libraries used to have them too. But anyways, all your contacts and right, I used to roll this thing and these little cards would flip by, and so you would either have content. But anyways, so you have all this information within you, and as someone is describing certain things, you're getting closer and closer to, it's kind of like a decision tree. If this, then this. And so hopefully a therapist has internalized and understood and wrestled with different theories enough to where they're not going to regurgitate little phrases, right? That they've conceptualized things. The big difference between a therapist who learned enough, memorized enough factoids on tests, and so now they've been able to pass tests. Now they sit in front of you. I'll give you a hint when you kind of know one of those. And it doesn't make them bad, but still, you know what? You're paying somebody. So they should be able to help. If what you're hearing more than not need to be careful how I'm going to say this, but here's just the reality. If they're just reflecting back to you what you've said, almost like session after session after session, like, well, so what I hear you saying is you're really frustrated about, yeah, okay, well, that's rapport establishing. You're feeling like they're tracking with you. That's an important skill. But if a therapist doesn't know anything, you can actually sort of get by with just continuing to reflect and say, well, how's that make you feel? So what I hear you saying is, wow, how's that make you feel? And what would feel right to you? That's a lot of therapists out there now that I think about it, right? I may know absolutely nothing. But if I have those 3 questions, I can actually survive a session. And you'll actually think, because you've allowed yourself to have insight. I haven't really done a darn thing. That's almost like a Freudian analytic kind of thing, right? So they allow free association, and before you know it, the person's figured out their own problems. That's not bad every now and then, right? That we need to be able to realize, wow, okay. Well, I think the therapist is wonderful, but really all I did is, by me finally having a chance, uninterrupted, to, and without critiquing myself, right? I've finally been able to put 2 and 2 together just by having somebody say, well, how do you feel about that? I don't like my mom. And, well, what's going on? Well, I got to get together with her over Christmas. Well, what's wrong with that? Well, when I go there, so what the therapist is seeing is, I'm under obligation. I don't really want to. So you may have a therapist that really knows what's going on, but all they have to ask is, well, how do you feel about that? Well, I really don't want to. Well, how does that make you feel knowing that you really don't want to? Right. So, but it depends upon who's asking that question. So you can have this is not a pejorative term. You can have an airhead therapist that knows 3 different kinds of questions to ask, and they'll still make a living. Or you can have a therapist that really has thought through things enough to where they understand how we're created, how we're made, so that they can discern then this from this. So if someone comes in and starts out by saying they're not feeling well, and the more you begin to ask questions, it's now that they're not feeling well because really they're frustrated or they're burned out. Or they burned out about, well, they're exhausted. Or they exhausted about, well, it's too tiring to be around people. And their boss is getting on their case. Why is the boss getting on your case? Well, I'm getting behind on my reports, or he tells me like I'm forgetting things. Now we may be going somewhere. For me, because I understand certain conditions, as it were, or what goes on within inside of the person, the more I'm able to elicit information, the more I'm starting to formulate. And that is true. That's what's called case formulation. So we're beginning to try to figure out what's going on. If I believe that, actually, one of 2 things. So I recommend, what you want, first of all, is somebody who is, and the term is now very commonplace or ubiquitous. It's all through now the counseling world. Trauma informed. Okay, so that's really what you want in a therapist. Why? Because that therapist has taken the time to understand deeper implications, the implications of deep woundedness. That's not just a band-aid approach. Therefore, they know. So a trauma therapist understands that the things we go through, there are different degrees, and that you can go through things that'll shake you to the core and will impact you, body, soul, and spirit, mind, will, and emotions. A trauma-informed therapist will probably not just come from a straight-up behavioral perspective, carrot and the stick. I'm trying to think if there would be a trauma-informed behavioral therapist. That might be a little hard to mesh. Why? Because a behaviorist is really just going to focus on behavior. So if you go to a therapist to lose weight and they're a behavioral therapist, they're going to work on diets. They're going to work on calorie counting. They're going to work on food groups, right? So they're going to stay at very surface level. That's not a pejorative term. It just means that's their orientation. We're going to try to help you move toward the positive and decrease the negative. So if you go to a weight loss program, Jenny Craig, Weight Watchers, Nutrisystem, that's a behavioral approach. Now they've added what's called a cognitive behavioral approach. So that'll be the next branch of counseling. So I guess I've now launched into this. So one school of counseling would be behaviorism. The next would be cognitive behavioral therapy. And there's positive things from each of these. That really means that my behavior, so cognitive behavioral therapy simply means this, that my behavior is indicative of things that are going on under the surface, but primarily my beliefs. Beliefs will affect thoughts. Thoughts will affect feelings. Feelings will create behaviors. So ultimately for cognitive behavioral therapy, you'll begin to work on or identify beliefs. And that's a pretty reasonable, that in a way that's always in play because we do need to look at what we believe. But that's still for a behaviorist or a cognitive behavioral therapist, they may not understand trauma. They may not believe that trauma even goes deeper than just cognitive beliefs. Because we can know something, but it's still not make a difference. Like, why are you still dating the guy? You know he's not good for you. I'm not giving him, right? How about cycles? Even in 12-step programs or, AA, NA, whatever, right? When they have certain phrases, right? Denial is more than a river in Egypt, but they also say about the definition of insanity. So it's a very cognitive behavioral approach. So insanity is doing the same thing time and time again, expecting or anticipating a different outcome. And we go, what the heck? What's wrong with me? Okay. And there's time and a place again for that. But if somebody has gone through trauma, the root is at a deeper level. It's at a deeper level than just straight up behavior. It's at a deeper level than just thoughts and beliefs. What I would say is this. It's at a level, and you have neurochemistry, you have what's gone on within the cells of the brain, the neural pathways. So it really has affected the whole person. It's affected, what I would say is this, the impression someone now has. How about this? The impression and perspective on a very deep level. Deeper than one can put their finger on it initially. And so oftentimes we might call those. So let's say if somebody has gone through trauma and now they have a fear. Well, it's not an intellectual fear. It's not rooted in a belief. And we could say possibly, but for the sake of this discussion. Okay, I'll give you a real example. After 9/11, if anybody's old enough, if they remember that, Twin Towers, right? The planes flew in and Twin Towers come down. Whether anybody, right? But after that situation, all across the US, you had people that suddenly had fear of heights. I was out in California at the time, and I started working with a number of patients, or actually I call them clients, but a number of clients who were not able to go up in elevators. I had one guy in San Francisco who had to quit being a part of a law firm because they were on the, I forget it, way up in one of those very tall skyscrapers in San Francisco. He just couldn't do it. Now, what's the likelihood it would ever happen again? Probably not. The likelihood of a plane flying into another building the way those did on the West Coast, right? You're more likely to be hit by a car as a pedestrian than you are any of us going through another 9/11. But why were they having panic attacks? Or because number one, visually they witnessed it, and that, we very much are. We're all interconnected now, especially the internet, meaning live feed, right? We can pull up TV, and so it's as though we're there. That's also what's going on in the Middle East right now in Israel. That's why it's so intense in the Gaza Strip and all that, because we're seeing this, and therefore it's almost like we're there. So we are experiencing what's called vicarious trauma. And if we see enough of it, of course, what happens? We get trauma overload, right? We get compassion overload. So that's why we do need to take care of ourselves. But if somebody, again, has been traumatized and they go to, there's two levels, as it were, two kinds of trauma, one in the here and now, and the other from childhood. Those are going to create different kinds of trauma. And so the term complex trauma. It's an important thing to note because, again, depending upon the therapist that you're working with, if the therapist doesn't believe that there's certain things that somebody can experience beyond what they can imagine, then they're not going to have an appreciation for what kind of impact. So when, for instance, now, as we're going to kind of zero in on the issue of trauma, and it makes all the difference in the world. Because if I, as a therapist, if I don't believe that anybody would do anything more than, and I'm not minimizing this, but let's say, and this is still horrible, right? But hitting a kid with the belt buckle of a belt, that's still horrible. Okay. But let's say if someone were to ask me, what's the worst thing that you can do to a kid? And let's say I saw a movie, and let's say that was still shocking to me. If that's the worst thing that enters my mind, then I'm not, and let's say I actually also don't believe anybody would go further than that. That it just, no one would. If you say, well, what about, no, it just doesn't happen. Why? Because no one would ever do anything more than that to a child. That's it. That's the threshold. Well, you can imagine then in my mind, look what I'm limited to versus torture. So therefore, I'm not going to have clue one to understand that the other methods, a behavioral approach, cognitive behavioral approach, the cognitive behavioral approach, you can actually have somebody memorize true things like corrective beliefs. We're going to replace your self-defeating beliefs by writing down happy thoughts on a 3x5 card. And when you start to hear some negative self-talk, you know what? Take that 3x5 card out and say, I'm not minimizing this. Okay, this almost sounds blasphemous. It's not. I'm a child of God, and therefore I am worthwhile. Okay, I'm not minimizing those words. But if that's my answer to someone, let's say, that can be my answer to someone who hasn't experienced trauma. Let's say let's say their parents got down on them, and so they don't feel worthwhile. And so suddenly, for the first time, the truth of those words can supplant. It's almost now like somebody sitting down at the keyboard and inputting new information. Or you open up a Bible and it says, for God so loved the world that he gave his only son, and whoever, and let's say I've always been worried about making it to heaven. I'm like, really? I mean, they can relax. So with that new information. But if the damage that was done was more profound than just lies, or distortion of truth that wasn't paired with other things, then I can be writing on 3x5 cards and collect them and create my own old-fashioned Rolodex. So it means I put them in this way and I just start spinning it, and up will flip these cards. And it's like, so I think that's taking every thought into captivity. And so I have 12 verses on 3x5 cards, and I'm just going to keep memorizing them because I'm starting to get depressed, and I'm going to pull myself out of this depression through these 12 verses. I'm not minimizing the power of Scripture. What I'm saying is it's a misapplication because it's not fitting the infection or the part of me that's wounded. There's a deep infection way deep down inside, and somebody's treating it with topical. There's a time that something topical will work. So you don't need to have surgery. But I want my physician to be able to have the full continuum of options and the wherewithal and knowledge and sense of, okay, what are we dealing with? So I may have some dry skin that's itching. Well, he may give me cortisone. Okay. May work. But let's say he believes that all itching and dry, flaky skin, cortisone. Why? Because he went to school. That's what he learned. And dry itch means some sort of irritation, and one size fits all. Well, are there any other things that can cause dry, flaky skin? Yeah, including cancer. So I want the person that I'm working with, that was a very long way of describing that, wasn't it? So I want the person that I'm working with to be able to have a fund of knowledge, a full orbed understanding, especially if it has to do with trauma. And I want them to not just appreciate trauma, but also, sounds funny, but right, to believe in it, meaning to really believe. And I can speak from experience, having crossed that threshold or that barrier, gone through that barrier, that I remember what happened on the inside of me. It was like, this is real. So you want a therapist that really, really believes it's real. So therefore, they're going to be able to take all the schooling they've had, all those different counseling models, those different theories, to be able to apply them properly to the right thing at the right time. So you want to make sure that you find the right kind of therapist. So you want a trauma-informed therapist. And then, as I think I mentioned previously, it's a good time right now because there are enough things you can ask as far as screening a therapist. So you look for a therapist that is trauma-informed, that understands complex trauma, is still trauma-informed. And then, again, the school or model of counseling now, IFS, Internal Family Systems Therapy. That is a reframing now of really dissociation and even more than that, internal splitting. So they're destigmatizing that, because back in the day there were certain terms, and even still it can freak people out. And even within IFS, right, they'll say there's parts, but then there is D.I.D. Okay. I'm not minimizing it, but from my perspective, why are they doing that? I understand it. I'm not going to be able to speak for them, but in their mind, they've separated it out. Okay. Well, you tell me, for anybody, even IFS therapist. And again, I recommend you ask a therapist if they're familiar with IFS, because that's the kind of therapist you want to go with. But I also want to just share this little caveat. If you think there's a distinction, then you may be approaching it that way because in your mind as a clinician or your therapist may still think that the real separation or D.I.D is still very rare. I don't want to freak anybody out. Now I probably bummed some people out because they were saying, no, I don't want D.I.D. And I like this because now I'm okay with saying parts, but I don't have D.I.D. That's very common these days. That's why I like IFS, because we don't have to talk in terms of D.I.D. But the reality is this. If you've been through trauma and if you have internal parts, you've got parts. Oh, what do you want to call that? I don't care what you call it, but don't get caught up in, do I just have parts or do I have D.I.D. or D.I.D. NOS, or right? But you want a therapist that, okay, I'm jaded. This is from my perspective. You want a therapist that understands about multiplicity and how that works its way out, how it manifests itself, and the internal system. So ultimately, part of my role with people that I work with is I try to get rid of labels. And that's why I like IFS. So nobody has to worry about feeling like, oh my gosh, I have a disorder. So they feel, who wants a disorder? Right? So they don't have to feel stigmatized. But I wouldn't worry about some of those labels. So where else am I going with this? So you want a therapist that is both trauma-informed, understands now about IFS. If a therapist doesn't, don't walk out. Just say, oh, well, I've learned about this, or I'm familiar with it. Does this sound like something? And so if you've learned about it, I would recommend every survivor go learn about IFS. And that way your therapist may not have heard about IFS, but they may be very competent. I hadn't heard about IFS until just 2 years ago. So just because a therapist hasn't heard about internal family systems therapy doesn't mean they're not competent. But you can begin to then ask them, do you believe that somebody can have parts? Well, that's either going to resonate with the therapist or not. So that's kind of what you really want to know. So you want to find the right kind of therapist that has the perspective that this is very real and that they have a sense of the process. And you can ask them. And so maybe I'll give you an overview. What is that process? Then we'll go into still some of the more symptoms, as it were. What do you look for within yourself? But Emma, do you have any questions? I'm doing all the talking.
You're doing great. Thank you. I don't have any questions right now. I think this is really important just because I think this does get confusing. A lot of people who are coming out of, for the demographic that we're talking about, people with D.I.D, satanic ritual abuse survivors, human trafficking survivors, many of them had no clue that they would ever need therapy. They just all of a sudden get hit with this whole other life that they lived, and now they have to consider it in the midst of going through trauma, which can be traumatizing to think about. I feel so horrible. I'm going through all this stuff. Like I can't even get out of bed. And now I have to go learn about therapy and like figure out where to go and what to ask. Like where do I start? And that can add like a whole nother layer of, panic and, as you call it, adrenaline rush, and this is really helpful for people. This is a really, really important topic, and my heart breaks for all the people who, for one reason or another, therapy didn't work out when they were so hell-bent on getting healed. And for whatever reason, whether, like you said, they quit because something inside of them, or they just weren't understood and felt very unsafe in that environment, to give people those tools to say, okay, if you're in a position and you do need help, here's sort of a checklist of what to look for. It makes somebody's life so much easier, I think, who's going through that, and really helps them be able to narrow down a focus instead of, something seeming so daunting. You're taking something that would be very overwhelming and simplifying it for somebody. So I really appreciate this. It's really helpful.
Yeah, let me give you kind of an overview, and then we'll kind of now do a 30,000 feet view. Kind of, we're way up in the clouds. So what what are the phases? First of all, how long, if you're a trauma survivor, so I'm going to use that blanket term. If you're a trauma survivor, you're looking at longer term therapy. Now, how long? Let's not go there just yet. It ain't going to get done in 6 sessions. Why? Because trauma takes a while to get over. Okay, so be realistic. Okay. Oh, okay. I know what you're talking about, John. I'm going to be in therapy for 20 years. I didn't say that. But what I just said is this: you're not going to get it done in 3 months. Okay. So be prepared for a process. How long could it take? Depends upon the degree of trauma. Now, think about what we're talking about. We're talking trauma. Trauma, by definition, is something way outside the norm. That was overwhelming. Okay. So you're not talking about like your typical EAP, employee assistance program, that you may have access to work. They have 6 free sessions. Okay, you're not going to get this done in 6 sessions. It may be reasonable to think in terms of where some people may be discouraged, but right, you're probably looking at a couple of years. John, I can't believe you just slow down. Okay. That's probably about once a week, but here's what I recommend. As a matter of fact, let me talk about frequency. At first, I would recommend this: a couple of sessions, but a 2-hour block of time. Also, if you go to the chiropractor, double up on the sessions the first few weeks. Okay, a little trivia there. Okay, because of woundedness, and that's really what we're talking about. If you're normal, you've become defended against this pain. Well, how long has this gone on? How old are you? So how many years have you kept this at bay? And the problem is you're probably very competent. Now, you may feel like life's caving in on you, but that's different than look at how far you've been able to come, and it doesn't matter, right? So think about everything I say, it's so funny now. None of it's funny, but think about, as I think about my work with trauma survivors, I'm so geared now. I almost hear inside of me, I know the different voices, as it were, the naysay, right? So when I say you're very competent, a part of a survivor just said, no, I'm not, because I wouldn't have to be even listening to this stupid podcast about the possibility of therapy if I was competent. I wouldn't be having these problems, right? So you already have the, okay. True. But just take this for what it is. That the issue of a survivor, I'll tell you what, if you're a survivor, I'll tell you what your issue is. The real issue is this: you're too darn strong for your own darn good, and you don't know it, and you don't believe it. You've been hanging in there way longer than you should have, and there are times that you've given up way earlier than you should have, but it doesn't make you crazy. It doesn't make you a failure. What it means is this: your internal radar and your internal compass has been all tinkered with in a way. It got all out of whack, and you've been flying. You've been doing the best you can with what you've been given. You've been trying to keep it together. But why haven't you risked maybe sitting down with someone prior to this point? Because you've been pulling yourself up by your bootstraps. You've been cinching those laces down even further, right? It's just, you've been grinning and bearing it. You're going to power through this on your own. Okay, right there, you've just demonstrated to yourself you're not a wimp, you're not a weakling. Right? If you were a failure, wimp, or weakling, you would have given up by now. And you are competent. Look at how many different things you've negotiated without ever telling anybody what's been going on inside of you. That's significant. Because a trauma survivor, especially someone that has been through sadistic abuse, ritualistic abuse, SRA, and then MK Ultra, think about what they live with every day. It's one thing maybe if I have negative self-talk going on. It's a whole nother thing if I've got talk going on. That's a whole nother ballgame. I can't even imagine having to have that level of debate and then the dissociation on top of it. Talk about crazy making. So to think that somebody could still be functional with all that going on, I mean, I go crazy. I go into the kitchen. I just want to fix my, it's funny, but it's true. I just want to fix myself a little bit of breakfast. Well, before I know it, I've got Sebastian, the Bengal cat, which we thought was just a little tabby, who has a higher IQ than I do. All of a sudden, before I can feel Sebastian, he just knows. So within 30 seconds, and I don't know who's trained who, but I feel his little eyes. He's hopped up on his little, we got a little treasure chest thing, and he's staring at me. Well, you know what he wants, right? No, I'm just here to, I tell myself now, I'm just going to zoom in, zoom out. So I zoom in, starting to fix something. All of a sudden, now Sebastian's there. He hasn't said anything yet, but I like Sebastian. He's a fun cat. Well, he knows, right? And he's got a vocabulary a mile wide. He's got all these different voice inflections or meow inflections, and he'll start. Well, he's talking to me. So I've just come in to do a task, and now I've got these eyes. I'm aware of this presence, and now Sebastian starts. And now he's playing on my nerves. He's playing on my heartstrings, actually, because if anything, he's a little overweight. Well, he starts going on. I said, no, you're fine. So now I'm dialoguing, and I'm just, the more he's talking to me, he's working me. Now I'm getting more irritated because I just want to get in and get out. Leave me in peace. And then what does Sebastian do? Oh, yeah, he ups the game. He calls Mr. Knightley, his brother, different litter. Mr. Knightley is perfectly silent, but he has an advantage. He still has a kitten-like meow. It's the funniest darn thing.
Oh my gosh, how cute.
We have this little high-pitched. Well, Sebastian knows I can sort of resist him because I can reason with him. So I'm talking to my silly cat, but I'm already starting to be broken down. And remember what I just wanted to do. Want to get in? Go fix a little breakfast or something. So Sebastian starts working at me. And then comes Knightley. And Knightley's got this little kitten-like, who can resist that? And now they're both. And then we have Stanley, the standard poodle, who looks like a labradoodle. And then all of a sudden, now he comes, and he's very smart because he knows the cats are going to work me. And once I know I'm finally going to give them a little treat, Stanley gets something. So Stanley's rooting them on. I think Stanley organizes this whole thing anyways. Okay, now that's just with pets. And that's on the outside of me. But I can walk away from the pets, give them treats, silence them on my business. But they're not on the inside of me. That takes a lot of energy every day. And that's when I am present. Then before I know it, as we talked about before, dissociation, before I know it, it's like I look at the clock or I look at the calendar page, and now I'm freaked out. And now, as one of my clients say, my brain's broken. Why? Because I can't account for what happened. I'm sitting at work. Last thing I knew, it was 9 o'clock in the morning. Now it's 3:30. Did I do my reports? And so that's why if you're going to go to my desk, probably you're going to notice I'm almost anal retentive. This is more times than not, more times true for somebody that's trauma survivor and has the internal parts. They're very organized, or they may be a pocket perfectionist, but there's going to be certain things that they look highly organized, but it's actually survival. If a place for everything and everything in its place, why? Because that's the only way they can tell if what's gone on. And so, bless their heart, think about how, right? So they're always on point. Think about muscle tension then, because they just know they have to keep to a schedule, or they have to remember, depending upon their job. But the more they have to interact with people, they have to keep track of conversations. But what happens if they keep going away? And now they have to do a follow-up conversation. But you can't remember first conversation. Think about the energy that takes. So no amount of cognitive behavioral therapy, by the way, or behavioral therapy, isn't it? Right? Well, just take a rubber band and snap snap your wrist and you'll come. It doesn't work that way. I forgot where I was going. I noticed I do have a tendency. I'm trying to dump the truckload of information. Sometimes I do, my train of thought goes somewhere. Emma, do you remember where I was going with that? See, talk about
No,
train of
it's
thought.
okay. These topics do get there's a lot to cover with stuff like this. And you're right, it's fascinating trying to put yourself in the shoes of somebody's perception or way of life that you'll never experience before. So we were talking about dissociation, and you gave the kitchen example with
Oh,
the
that's right.
kitty.
About the energy, right? About how
Yeah,
much
the energy.
energy. So
Yeah.
on the inside, if I don't realize, so if I'm a trauma survivor, especially with more profound trauma, especially as a child, and if I don't understand the idea of parts or the splitting, as it were, and therefore all the more if a therapist doesn't believe in it, then a therapist is not going to, I think that's where I was going, right? Won't be able to apply the right application, the right ointment to the wound. So you want a therapist that understands the concept and believes in the concept and doesn't, here's another thing, it doesn't necessarily believe it's all that rare. I don't think this is all that rare as far as parts. I think I mentioned last time, I think probably 40%. I think 60% of women have been sexually abused by degree and to whatever extent. 20% of guys. So that's going to be one of the most profound ways that splitting will take place, that the parts traumatize. You can traumatize someone just through violence, but the sexual abuse, especially if it's consistent and persistent, because then the perpetrator, the goal of the perpetrator ultimately is this. Hopefully this will be helpful to the audience. The goal of the perpetrator is not to get busted. Let that sink in. The goal of the perpetrator, of course, is to perpetrate, but above and beyond everything else, they don't want to get busted. So just so that any survivor understands, what was going on in the perpetrator's mind is this: they want to cross boundaries. They want to manipulate. They want to take what you have. They want to overpower you. They want to manipulate you. They want to, the more sadistic kind of stuff, ultimately they want to traumatize you. They want to mar and scar. They want to leave a lasting negative impact on you. Okay, that's their goal. But their overarching goal is they want to make sure they never go to prison. So everything they do, while they're trying to incrementally encroach upon a survivor's boundaries, a victim's boundaries, as they're starting to harm the kid, every move a perp makes is done with, it's like chess, and that's why the sadistic ones, right? It's all about game theory. That's what psychopaths are all about. They're trying to figure out how to ensure that they never go to prison. So it's always about moving towards getting what they want, but above and beyond all that, making sure they never go to prison. So that means everything I'm going to do, if I'm an evil perpetrator, I'm not, but right, because I know how they think. Because again, having worked with sex offenders now for 15 years, while they are taking and doing and harming, they're also always playing defense, which means everything that a perp does is going to be toward the end of ensuring there's an insurance policy. 100%. So that's what every survivor needs to know. That's why, as the perp is creating, think in terms of SRA or MK Ultra, but still, the perp is helping to facilitate the creation of more alters, more parts through trauma. You're overwhelming the person, and they know that the splitting is taking place. What do they immediately start to do with the parts? The perpetrator. They're going to make sure that the perp is going to make sure that the perp can create on the inside of the person a self-governing mechanism to where the perp doesn't have to worry about it. So they're going to, and here's an important thing for every survivor to understand. So the perp is going to work toward the end of persuading the victim, the survivor. So they're going to work toward ensuring that the child is so convinced and so persuaded that they're going to keep the secret. They're never going to open their mouth. So you can take everything that MK Ultra does, just shy of implanting on an electrode, and I mean that in all sincerity. Okay, because if an electrode has been planted, the only hope is getting the electrode out, right? But everything else, the good news is this, you can overcome it. How? Truth. Because what they fed you then was distortion of reality. What they fed you was impressions. They convinced you ultimately of lies. If I convince a kid, when all is said and done, meaning I've done all I can do and I'm doing all I can do. Again, I just want to clarify for the viewers. Okay. I understand how perps think. When all is said and done, as I'm harming, or let's say I'm finished after years, the only thing I want to make sure as a perp is that kid that's going to grow into an adult never says a word. How do I ensure that? Well, I'm still getting what I want. I have to be so persuasive that I craft reality in the kid's mind so that the kid right now who grows into an adult, but on the inside, right, in a way, we're all eternal. So there are parts of us that never grow and aren't supposed to. That's different than maturity, right? As a matter of fact, even in business, some people are familiar with this. There used to be like plaques or posters, right? Everything I needed to know about life, I learned in second grade. And so it's a nice little poem. I learned how to play fair in the sandbox. I learned how to, right? And so those are geared for business people. And it's to help them understand that, life is about treating people properly and take time to smell the roses and, whatever happened to that childlike part of us. And so we all understand that. But if I ever lose the vim and vigor for life, if I ever lose the ability to be inquisitive, to have hopes and dreams and enthusiasm, those are all very childlike qualities. How about the ability to belly laugh? Have you ever seen one of those? My wife has a little TikTok thing. It's the funniest thing. Two little infants, or no, they're crawling, so they're probably a year and a half or 2 years, and one has put a little blanket over his head, and so you have this one that starts laughing, and just think it's so funny because sees a little blanket moving, and before you know it, the other baby takes the blanket off, and they both just start to belly laugh. So if you've ever seen a little video of an infant or a little baby belly laughing, nobody has to teach them to do that, right? A very young child is fully in touch with their emotions. That sometimes is part of the problem, because if you've ever had a child and you're treating them well, right, they ricochet, right? They're either super happy or they're crying, right? But they're fully in touch with all their emotions. But in a way, the goal of life is, though we want to be able to learn how to manage our emotions more, we don't want to end up cutting off or deadening or dulling those emotions. So trauma survivors end up having a range of emotions in a world of 31 flavors. It's all come down to, it's just kind of gray. And that's why oftentimes one of the diagnoses that a survivor will be given before they even know they're a survivor is, it used to be called dysthymia or low-grade depression. They don't have any real highs, but they don't have any real lows. But it's just, yeah, it's like, what is the sky color like in Seattle during the winter time? It's just overcast. Some people have what's called seasonal affective disorder. If you take those three words, it's SAD, right? That's very true. It's with the pituitary gland. And if they sit in front of a light table, the right kind of light, they'll start to come out of that depression. So light has a way of affecting mood. And it's no accident then that Starbucks and Seattle's best coffee came out of Seattle, because everybody needs a drug to get themselves up. So everybody needs a caffeine fix with that. So if I've been through trauma and I haven't been able to work through my pain of it and the trauma of it, I'll find there's a blunting of my emotions. So I've lost the natural childlike, or the natural ability to be childlike, and to, so a big part of it is laugh spontaneously. So that's one thing that a survivor, before they even are aware of a lot of things, you can ask someone, when's the last time you just knee slapping? My kids, I'll say, Dad, you're funny. When you really start going, you start chuckling, you slap your knee. I said, what? That's true, right? If I see something that's really funny, I do that. So can I laugh spontaneously? Also, can I laugh at myself? If you've been traumatized, you can't, and you don't know it. As a matter of fact, you'll probably think back and you watch some of those videos of children just belly laughing. And that's because that takes a degree of freedom and spontaneity. If somebody has been traumatized, all the spontaneity has been taken out. Why? Because you can't afford spontaneity. Because you have to be on point. So somebody has changed your perspective of the world. So with a trauma survivor, they're not aware of the fact that very deep, on a very deep level, the world has changed. And see, there I go again. I sort of forgot where I was going because there's so much. Let me try to bring it back to my train of thought. Unless you have a question right now. Do you have a thought right now? I'll remember where I was going. And my apologies, Emma.
No, it's really good information, talking about, these different perspectives. And again, like,
And if somebody's trying to follow me, my apologies, right? Because
no, this is
sometimes I
great.
have a
It's
tendency.
so much
So I'll
information.
again try to bring myself, but I do have my notes in front of me, but I'll try to.
Yeah, no, there's a lot of information to unpack with this stuff, and so I think ultimately, you're discussing, like, from a therapist point of view, like what to look for, and perpetrators, like what's going on in their mind
Oh,
too.
that's right. The mind of the perpetrator, and what his goal is to make sure that
Yeah, silence.
he never gets busted. So I want survivors to know. Thank you. I want survivors to know that. So the goal of the perpetrator, by whatever degree, including MK Ultra and satanic ritual abuse, is ultimately to make sure that nobody ever talks. And so they know the splitting. That's where I was going. Sorry. So what the survivor is left with, those that have parts, is on the inside, without knowing it, parts of the survivor have picked up where the perpetrator left off because they've become convinced. And they don't know they've been tricked. We call that trauma bonding. But again, as I mentioned one time before, a better term, because if I tell someone they're trauma bonded, and I understand the term, that's why I used it, but it's not a beneficial term, and I'll tell you why. There's nothing bad with it, but here's a more beneficial term, because if you say somebody's trauma bonded, well, what do you do with that? I don't know, because I'm bonded. How do you unbond? I don't know. Right? Got to go cold turkey, or get no contact. Okay, there's nothing wrong with no contact, but no contact is for a reason, not a permanent status. In this sense, it's to help regroup so you can figure out what happened, so that if it makes sense, or if you happen to have to see the person during that break in time, you can get rebar in your soul, so that the next time you see that person, you have boundaries. You're not blown over anymore. It's like when Rapunzel in the movie Tangled, when she came out of the room after she saw all the pieces came together. She's blown against her dresser or her bureau. And when she emerged, right? She's on that second floor in her little tower, the Tower of Mother Gothel. Rapunzel comes out. She pushes the curtain back. Mother Gothel's coming up the stairs. The last Mother Gothel knew, she had Rapunzel back where she wanted her. When Rapunzel says to, I'm sorry, when Mother Gothel says to Rapunzel, she's taking the flower out because all Rapunzel knows is because Gothel, I'm talking about like SRA, very interesting. Gothel left the impression, she set it up. That's very interesting. I hadn't thought about this piece. Gothel had knocked Flynn Rider unconscious, right? She ties, so Gothel, the evil stepmother, the evil mother, the lady that kidnapped Rapunzel, but Mother Gothel, conks Flynn Rider, ties him to the mast and pushes him out. And in the story of Tangled, in that movie, we see those two ruffians and thugs, and they get conked on the head by Gothel, but they were the one to just look at, they direct Rapunzel's attention to Flynn Rider sailing off, and they implant the idea, you were in love with Flynn, you began to trust him, but look, he left you. So they set up a scenario that changed the internal worldview, right? And you see she deflates. At that moment, Kong, the ruffians and thugs and thieves get knocked out. Mother Gothel is there. She seems like the savior. And there's a very powerful moment in that video where Mother Gothel all of a sudden does this like, come to mama. And you just see Rapunzel, who was just starting to find her voice, find herself, deflates. And there's that reunion, and she's back in the cult. And then the next scene we see, she's in her old bedroom on the bed. Mother Gothel takes the flower out of Rapunzel's little hair. And Mother Gothel says, it never happened. And that's the last we see. Mother Gothel's going to go down and fix dinner. And all of a sudden, we see the transformation. The one little piece of light hits, and before you know it, all the pieces are coming together. We could say those are like the different memories. And now she sees the truth. It really is therapy in a nutshell. If you want to know what therapy is like, when it finally happens, but it'll happen kind of little by little like that, those moments of time. When Rapunzel emerges from that room, I urge everybody to go back and rent the movie again. Or I own a copy of it just because I use it so often in counseling. She sees it. She realizes, wait a second. Gothel stole me. She's not my mother. And so all of a sudden, truth did its work. You'll know the truth. The truth will set you free. Now, Rapunzel had rebar. And she didn't even go to a therapist. But it accomplished, the truth set her free. So she emerges. Gothel doesn't know that Rapunzel has suddenly had 17 years worth of therapy in 30 seconds. Emerges, meaning Gothel doesn't know there's been a change. Gothel's coming up to ask some sort of question. She doesn't know that now on the landing of the second story is a very different daughter. Gothel's coming up the stairs, and now the internal that comes out, the dialogue that comes out of Rapunzel, it ends with, or should I even call you mother? Whoa. She found her voice. Gothel, being the good, sadistic equivalent of MK Ultra, SRA, everything wrapped into one, to keep her in a prison. Peter, pumpkin eater, had a wife, put her in a pumpkin shell, and there he kept her very well. Now, I don't know, I'm just using that analogy, the idea of if you aren't free to vote with your feet and to have a voice and state your preference, you're not free. You need to be able to have your preference, have your voice, state your preference. That's the goal. Then you can also be fully emotionally present in the moment. That's another goal. But as Gothel comes up, she sees that, whoa, where did those words come from? Gothel knows, and again, they did a brilliant job. And then Gothel is ascending the stairs, and Gothel shrugs it off to give Rapunzel the message, I know what you said, but you really don't mean that. So the power, she's going to take, Gothel's going to get Rapunzel back submissive. But because the truth did its work, she's out of the cult. She's out of the family. She's out. Oh, she's still under the same roof, but she's free. She's got her own power, has her own opinion. Can't be talked out of or talked into something that's not true. And the moment that Mother Gothel, the moment the cult leader, the moment the person that's been programming, whatever term we want to use, the one that's been most persuasive and powerful in her life, once Gothel knew the gig was up, what did Gothel do? She really became Gothel. Daggers and chains. Meaning now there was no finesse, was no PR. Now it was, okay, that's the Gothel I've been dealing with all the time. But because, and now Gothel is straight up criminal. That's interesting, right? Gothel was a cult leader first, couldn't have gone to prison. But once all the power shifted, Gothel went for illegal activity. You can't go around stabbing Flynn Rider and not be arrested for attempted murder. Okay, so the truth came out. But Rapunzel was free at that moment. So that's really the goal of therapy. So the goal on the inside then ultimately is to be able to know what is true. But the perp, since they don't want to go to prison, all their efforts, along with getting what they want and doing what they want to do, the overall arching thing is got to keep them silent, because they know unless they're going to kill the kid, that kid's going to grow up. If that kid grows up, the more they grow up, and if they have contact with other people, it increases the likelihood that that person's going to talk. So the perp's goal, everything the perp has as far as the strategies and the tactics, while they're doing what they want to do, is to so play with the person's perception of reality and what is true that the person then picks up where the perp leaves off. And they keep themselves in prison because they've been persuaded. And that's why we liken it to, that's why you can liken it to the Stockholm syndrome. So it's not, by the way, again, it's not trauma bonding. What it is it's half-baked healing. I'm so close to the truth because now at least I can see the person's, I can see bad aspects of them. I can see that they didn't act in my own best interest. But why is it that when push comes to shove, I'll still defend them? Why is it I will pick up where they left off, where they used to say, I know what it looks like, but it's really not that. Now I'm saying to myself or other people, well, I know what it looks like, but it's really not. I know that they rape me, but it's their way of showing love, or they don't, right? Or I must have done something. So I pick up where they leave off. I make up excuses for them. Or I also have allowed to craft my worldview of nowhere to run, nowhere to hide. So why even try? Once they instill that in me, then they can leave me. They've screwed me over in so many different ways, literally, figuratively. The deed is done. The crime is done. Now they can leave confidently. Why? Because, and here's important for every survivor to really know. Deep down inside, your perp believes you're stupid and you can't figure it out. Bottom line. You let that sink in, that'll help your healing, by the way. Because what I want to ask every survivor with all sincerity, with all due respect, is this: are you stupid? I don't think you're stupid. Then why are you acting like it? Now, I need to be very careful how I just frame that. I don't think you're stupid. You're not stupid. The problem is you have a high IQ, number one. So you're not stupid. But why are you, in a way, I'm not faulting anybody, but kind of go with this. If they thought you're stupid, and if thus far you've sort of allowed it to lie like this, guess what? You're confirming in their mind that you really do think you're stupid, but you're not stupid. And the fact that you're still listening to my voice with all the tangential things I've had, right? If you're still listening to what I'm saying right now, is you're already showing yourself and them something, which is this. You're listening to something you never should have you never would have in the past. Why? Because there would have been parts of you that are saying, don't listen to this, shut this off right now. But you're still listening. Why are you listening? Because something's resonating about this. And I'll tell you what's resonating. Parts of you are starting to figure this out. Just like Rapunzel, when she's in the tower and she sees those tiles, the mosaic tiles start to come together. Some tiles are coming together right now, which is, hey, right? For the first time, or not just the first time, but little by little, more and more, droplets of truth are starting to go into the parched ground, and something's happening. Eventually, new life is going to start to come from it. It's like your ship got stuck in the North Pole. It got frozen in there. It's now frozen over. And I've heard from National Geographic and other things, how do you get those ships dislodged? Apparently, they can take dynamite and they can blast a hole. And what'll happen is apparently a fissure, a crack in the ice, all of a sudden starts to run to the open ocean. That's the very first beginning of hope. That's what truth does. It starts to almost like, for instance, if you live in a state where it actually freezes, water can do a lot of damage. How does pavement crack? How do patios crack? Right? A little droplet of water gets in a crack and it expands in the wintertime. And before you know it, that little tiny droplet, just like also if you plant an acorn under a 4-inch slab of cement, that little tiny supple green thing will crack a piece of cement. That's why the perps have worked so hard. So if you're listening to this, if you're a survivor, if you think about it, one of the goals also is that the perps wanted to make sure, so your handler, whatever term you want to, the cult leader, your mother, whatever it is, wanted to make sure that you never got in the presence of someone that would begin to talk this way. It's almost like, meaning is not going to tell you truth. Think about every communist country. They have to control the media and they control what comes in the country. Why? Because the last thing you want is for somebody who is captive, who has decided to sort of give up, and they're just going with the program. They're just a good citizen. Meaning they're a cog in the wheel. The last thing you want is for them to begin to think for themselves. And to begin to have something, and here's the key, to begin to compare and contrast what they were told and the impression that was left upon them. And that's why every cult leader, manipulator, user, all the way up to the profound stuff, they have to isolate the victim or the survivor. They have to keep them away from people. And so they'll oftentimes, especially in cults, they'll say, it's us, they're the bad guys, they don't understand, right? They have to paint everybody else as bad. So even the trans movement, those are all transphobes. We're your new family. very cult-like, because they don't want somebody hearing truth from the outside, because truth will act like those little droplets of water. They will become like those little mosaic tiles for Rapunzel. And it's like, I mean, one individual one isn't going to do it, but one drop of water, then the next, then the next. And before you know it, you have a glacier that starts to move. Or like those glacier shelves and a big massive chunk falls off. That's a pretty good analogy to therapy, by the way. It's thawing something out, that there's a new, you are in there, but somebody layered all sorts of stuff. And what they did is they layered a lie after lie. They paired it with actual experience that was overwhelming. But in the midst of that, they told you lies. So they convinced you or they persuaded you. So really the process of therapy ultimately is helping someone be able to compare and contrast by virtue of being presented with truth, so that they themselves ultimately can do the work for themselves to know what is true. Because right now, every survivor is convinced of something, whether they know it or not. And in the internal system, there are a lot of parts, especially the ones that are persecutorial, the ones that are guards, the ones that will inhibit, shut the system down. They're persuaded of something, 100%. And so we say, well, they're aligned, okay? Just like, the Stockholm Syndrome. But what are they aligned by? They've come to believe certain things, which ultimately is keeping them away from intense feelings, which is ultimately their anger, by the way. So the perps, in beginning to create the degree of trauma that will create the parts, create the internal splitting, what they will inevitably begin to do is create internal parts that they will begin to focus on. And those parts, because of the trauma that's happening, will be told certain things. And in essence, it's inevitably a combination of this. So you can break down all the internal system really in three ways. You have the true wounded core of the person and aspects of that. So you have the wounded ones who want to be saved, who want to heal, who want to tell their story. Then you have those that have stepped in to protect them. Those are the very protective ones. As a matter of fact, let me take a step back. So you have the young ones that are being wounded. You have the ones that come in to protect. And then among the ones that are protecting, you're going to have certain ones that were told, and this is where the manipulation comes in. All of it's manipulation, as you're causing this fragmentation. But you have the core part and those young ones that were severely wounded. You have ones that came in to take the pain. The perps know that a survivor, okay, I'm staring off, because I'm conceptualizing it, okay? They know that on the inside, the survivor can see all this. They're living this. So, as I mentioned last time, you inevitably have a combination of this. You have the core injured parts. You have those that came along to protect. And then of the protective ones, of the ones that have been injured, you're also going to have some that protected, but still are young and still are childlike, typically young. But then then you have some of the protective ones, because some just took it to help, but they weren't able to protect. The perps are going to then focus on the protective ones. And they're essentially going to say this, and this really becomes the system. So once you understand this dynamic with the three aspects, then what they'll do is they'll multiply this, but it's the same dynamic. Well, then some that are going to sacrifice themselves. So you can actually have those 4 categories. But the ones that were protective, the perps will tell the protective ones, I should draw this out. Next time I'll have a drawing, but picture 3 different circles, or we could have 4. The core, then the other childlike parts that took the pain, then the protective ones, but they feel the intense anger. So they're the ones also that feel like demons oftentimes. So the perps are going to tell the protective ones that if these other childlike parts, if they talk, the perps are going to kill the core or the very young ones. So therefore, the protective parts, their goal ultimately, and this is what everybody needs to understand, every survivor, the reason ultimately why they're persecuting or going after the one that wants to talk is ultimately not because they're mean or they're a demon, is they're actually really good and really protective. That's a noble thing. What are they ultimately trying to do? Make sure that the core part is protected. The thing they don't know, and not because they're not smart, but they're too close to the forest for the trees kind of thing. They can't see that they were tricked because the perps aren't around anymore. Meaning the Nazis have left the concentration camp. They just didn't have the decency to tell everybody in the barracks. So the Nazis think all the POWs in the barracks are too stupid and become so persuaded. The Nazis think they did such an effective job that they left the camp so they don't get busted. You know, potentially the Allies are coming in. The camp is empty. But certain parts have picked up where the perps left off. But the reality is this. And so part of therapy, really a big part of therapy is this, to help people understand the camp's empty now. And they never liked you from the beginning. They used you and they thought you were stupid. They think you're so stupid that they're done. And you guys are keeping yourself in the prison camp. You don't have to anymore. So that'll be really then an overview of kind of where therapy is going to head. Now there are stages, but that's kind of in a nutshell. It's letting people finally realize and test. There are going to be certain ways in which you have to test. Like the very first, it's kind of like you got to peek up out the window, but they told you never look out that window. And now it's right. Somebody in the concentration camp, in the barracks or POW camp, has to look up the very first time, but you're persuaded if I look up, they're going to shoot me between the eyes. So you first hold up a helmet, nothing happens. A little by little, it's that first part, that first time every survivor can begin to remember. It's that first thing like, wait, like that holiday went by and I didn't die or something didn't happen. Or I've kept my job a little too long. Why do I still have somebody in my life that cares? Another thing is, why my therapist still alive after 6 months? And then they look up. So it's beginning to push back boundaries that they put, which are really the chains, metaphorically, that have now I've kept myself enslaved without even realizing it. Because I believe that I can never get out when I don't know, they never locked it now. It's just, you can make a lock look like it's locked, right? If you have a padlock, if you turn it a certain way, you don't have to push it down. But to somebody that's passing by a lock, it can look like it's actually locked and it's not clicked down. That's what's happened. They don't have the ability to lock it. They never had the ability. That's an interesting analogy. I hadn't thought about that till just now. They left the POW. They're gone. But when you've looked at the gate, there's the chain. There's the padlock. So part of my role with clients that I work with is, how do you know anybody's still there? Why do you have to be in there? Should you have ever been in there in the first place? And then ultimately, they don't have the power anymore. Step out. Walk into the yard. See what happens. And then look at that gate. Go test the lock. And that there's some practical things, right? Either do or don't do. That's that increasing awareness. And then it's like, right? Kick the gate. And all of a sudden it comes open, the lock and the chain fall off, or it just loops around the and it swings open. That's the very first time. In every survivor's experience, as far as in therapy or in their healing, they remember that moment. That's when some of those tiles with the Rapunzel moment in the movie Tangled, they start to come together. It'll get better, but then it gets worse, because now the possibility of freedom, those droplets of truth sets you free. That means enough truth is getting in there. The ship that's now been ensconced in the ice, all of a sudden, a dynamite blast of truth, and now a big crack. And that's the beginning. That's the beginning of freedom. But that's when, and it's that ebb and flow in therapy, and that's when there'll be some, they've been tucked away, that sense the kind of pain that's going to go off if I realize that everything I went through is because they didn't intend to do anything other than they did. They wanted to do it. They did it in the way to traumatize me and to make sure I would never talk. Tell you what, then there's no trauma bonding. Then it's, you got to be kidding me. Okay, that's when the nuclear explosions start to take place on the inside as far as rage. But those are layers, and it's just like any of us, whether traumatized or not. You know, if you've been betrayed, if you've gone through something very, very hurtful, or even if you have a narcissistic mother or parent, to begin to reframe things, it takes a long time, even without trauma, to just let it sink in, the meaning and the implications. Like, oh, you have got to be kidding me. Seriously, right? As a matter of fact, isn't that true? Sometimes we have phrases, we'll just start to repeat them. What's happening? It's layers of the onion. That truth is starting to come. It's like, right, if you ever, you yourself, or if you've seen anybody, when all of a sudden you can see in their eyes, it's like, right? It's that Rapunzel moment when that truth, you got to be crapping me. Like, seriously? Right? Then you watch me, seriously. And now, right now, all of a sudden, what's happening? I'm going to start getting some energy, because now I'm coming back alive, right? Tapping into some of that flip side of her is anger. But then I'm going to get up and say, seriously. Right? Somebody know, when somebody's starting to go through the healing, because they're going to become monosyllabic, because they're going to, and they're just, seriously. Now I'm going to get up and I'm starting to walk around my, seriously. Oh, seriously? Seriously. What's happening? All of a sudden, layers are starting, right? Layers of the onion, the tiles are, seriously. What's happening? The lies are sloughing off. The truth has set me free. And now for survivors, as I'm doing, seriously, what's happening? Everybody now, all the residents in the shacks, or what do we call it? The residence halls, they're starting to do what? They're taking note, because John Part is out in the courtyard saying, seriously, seriously. And now what's that? And somebody else comes out, but you have half of them are still ducking down. They still are under that lie. Somebody else is going, what's going on? So there's a magnetic thing about truth, right? It'll start to, there it is. It's going to start to reverberate. I guess I'm starting to describe some of that process of therapy. That's really therapy in a nutshell. It's little by little connecting with truth, but there will be some specific stages. But that's really, in a nutshell, if I could paint it out, it's right? The Nazi guards have gone. I'm in the barracks. We're all in the barracks. And we don't realize we've been in the barracks. We've been functional. We picked up where they left off. They think we're stupid and they're getting a kick out of this, and they chuckled as they all left. And I've imprisoned myself. Or they started it, I picked up. And we've been going about our business in the barracks because I still think it's true. And when a survivor begins to ask some of those hard questions, allow that to start to truth to do its work. The truth will set them free. And then they'll come back alive, right? All the depression will start to end, the panic attacks, all the things they've experienced. But to begin that process, you need to know, is a part of you in that concentration camp? So that's where we start to look at some of the symptoms. Okay, any thoughts? Because I've been talking a long time. I can keep going. But
No, you're doing great. That reminded me too, whenever you're talking about that, I'm sure you've seen this, but I've seen pictures with sort of a little explanation where you see this big elephant and they have a string tied around
there it is.
one of their legs, and it's, to a little plastic chair that's, the size of one of their
That's
toes,
exactly right.
and they're just standing there. And you learn that when you tie an animal like an elephant up to something that they can't resist and try to move forward, and try to break out of the chains, and they're resisted by something bigger than them, that eventually over time you take that chain and you can put it on a little lawn chair, you can put it on a stick on the ground, but the elephant will always associate that string to being stuck and not being able to move. Whenever you're talking about that, I was thinking about that, where if they just looked and were like, oh, the string is tied to a stick, I can move anywhere that I want with this, but they don't know because they've been so conditioned over and over and over again to be chained to something that's bigger than them and that weighs more than them, so they can't move, and so that mental pattern, that prison that they're in remains, even when, like you said, the prison doors are open, the lock's off, there's nothing holding you back except your own imagination, in a sense. So that was I love that you brought that up, because that we all get stuck in that, whether you're a survivor or not. We all go through these patterns really unconsciously sometimes. And sometimes it's good to look behind us, and to sort of course correct and survey the scene, in a sense, and say, I feel stuck, but am I? What am I actually attached to? What lock is the lock really secure? Or am I just, I've been so used to secure locks that I don't check anymore to see if maybe it's become unlocked, or maybe if the door's open, or maybe, like you said, if the Nazis have left the building, So I love that you brought that up, because that's a good reminder for everybody, no matter what, but especially survivors, because, they've spent their whole entire lives in enslavement and captivity. And then to all of a sudden, be free, and they've never experienced that. That can be, for people who haven't gone through that, that can sound really foreign, but if that's all that you've ever known is slavery, in a sense, and control, and you've never had freedom, you've never had, safe people around, you've never had free will, you've never had choice, that can be so foreign to somebody to even think that they could move out of a, open door. They might not even see the doors open.
That's right. As a matter of fact, let me use that analogy still for a moment. I'll show you how powerful this is. So we have the elephant. Let's say we're in India, and I think of the first animated version of the Jungle Book. Everybody remember that? And I don't remember exactly the song, but I remember the elephants were all in a row, and as they're walking, they're holding each other's trunks, and so there was this song that goes with it. So let's say we're in India. Here comes this line of elephants. They are free. So just this tribe, I don't pack, I guess, whatever you call herd of elephants. Okay. But they're free. They're in the jungle. They're living free. And they're walking by, and they look to the right, and there's a compound, or there's some sort of, right? They see the elephant that now is, quote unquote, domesticated. It lifts boards. It lifts palm trees. So it's a workhorse, but it's an elephant. So one day, let's pretend there's nobody around, and here come the elephants in a line, and they look to the right, and there dutifully is secured by a little rope and a balsa wood stake, this elephant. So here you have free elephants, and they're just walking by. They glance to the right, and they're seeing something that is peculiar to them, because they're coming from a context of what? Being free. having agency. They can make their own choice. And they look, and let's say they don't see they just see this elephant. They don't see what's attached to them. And they say, hey, what you doing? Come and join us. And the elephant, so now I'll play this out. The elephant says, what do you mean? The elephant says, what are you doing over there? You don't belong with man. You need to be free. You know, forget the king of the jungle. We're head honcho with it, but you know, so come on, get in line. We're going somewhere. I can't. What do you mean you can't? I have to stay here. Why do you have to stay here? Well, that's where I am. Well, I know, but come on. You're an elephant. We're elephants. We're going. I can't though. Why can't you? I've tried. What do you mean you've tried? I tried to do that before, and I'm stuck. It pulls me back right here. And they're looking. What pulls you back? And so even if, right, he'll probably lift his own back leg, right? Just because now muscle reflex, muscle memory. And so he takes a step forward. Look what happens when I take a step forward. And they look. And now we might have a little elephant that says, but that's just, I'll do a lisp. That's just some twine and a chair. Why don't you move it? Kick it off. And the elephant says, are you telling me that you're there because you got that little rope and a stake? Yeah, I can't. Here. So the elephant goes over and with its trunk, gets it off. Okay, there, right? There we go. Good for you, Emma. Right? So the elephant with the other elephant with his trunk, slips his trunk, and off goes the rope. And it might still have the memory of that. So maybe okay, now you can go. No, I can't. What's off of you? I still feel it. Oh, no, it's not that. Trust me, I can't see. You know, I've been like this. I can't turn my head far enough. Okay, trust it. Look, here, I'm holding up the rope. There might be another one. I still feel it. No, there's another one. Okay. So the elephant says, oh, okay, hold on. So the elephant then gets behind this elephant, gives him a shove. Get going. No, stop. No, get going. Stop. You're going to hurt me. Why? My leg. My leg's broken. It's not attached to anything. I know it's broken. Look, it's coming out of the socket. It's stuck. Oh. Now they're 5 feet away because the elephant's been pushing him. Oh. Okay, now go. I don't know if I can go. Why? Because the person that put this here, he's going to be upset. It doesn't matter. Come on, let's go. Oh, I don't know. What happens if they get upset with me? I know what happens. They always whip me. Well, you don't have to be in this compound anymore. Okay. So you can imagine how we can play that out. What I would say is this. If I was the elephant therapist, I would tell the big elephant that's helping the other elephant, I'd say, you don't want him to join you right now. And so what are you talking about? You want him near it? No. I'd say this. If he joins you now, he's going to be a good, dutiful elephant. You've just moved him from one location to the next. Oh, his world's gotten longer, but I'll tell you what he'll do. He's either going to be in the middle or at the end. He'll never be at the beginning, at the head of the line. Why? Because right now he doesn't have an independent thought. He doesn't believe he is entitled to one. He doesn't even have an opinion. He doesn't know. So you've taken somebody that's still enslaved on the inside and now made them free. And now they're half-baked. And they are ripe for the new master to come along. So the bull elephant freed him. And he says, now get in line. You're in, no, fourth place right there. Okay. And guess what? That'll be his place. And people say, therapy was successful. Okay. And everybody will think, and the elephant actually would say, wow, this is great. It's like Rapunzel. Touching the grass, never felt the grass before, but then she has that conflicted, best day ever. I'm such a horrible, okay. But she finally made it out. But how long did she last? And how persuadable was she when Gothel said, look, there's Flynn or the ruffians and thugs. Look how quickly she crumbled and went back to mama. So she had half-baked healing. She wasn't ready. Now, I'll tell you, how do you get the elephant ready? There's one middle step, and this is really important in therapy. We can use the elephant analogy or the POW camp. So the elephant now has looked, somebody's shown him the rope, it's off, you're free. Okay. You don't want the person to be able to now be convinced by other people that they're ready to go, that they're free, when they're not, because that elephant is still tied up on the inside because of this. That elephant hasn't seen the meaning and the implications of what was true all along. So what that interim step would be this: they would need somebody like John, the elephant trainer. I don't know, but let's say I'm not the elephant meanie guy, or they would need an elephant to come along and say, yeah, you're free. Well, I'm free. Then they would need this. So here's that key healing stage in therapy, which is this. As a matter of fact, here's the danger of the lie that says, you know what, regardless of whether or not the perp has ever asked for forgiveness, you have to forgive them. Okay, this is as dangerous as this. It's going to keep somebody stuck. Okay. They would need somebody to come up. The elephant now sees that they are free. In the POW camp situation, they've come out of the barracks, but they're now congregating in the yard where they used to have to line up, and the commandant would come out. So they're out in the yard, and meaning they're only coming out because now somebody's kicked that gate open and they realize that this camp is empty. The perps, the Nazi guards, they're gone. They don't have to stay in here anymore. Okay. They're almost ready. Here's the key step, though. They have to let the truth do its work. And the truth is basically this: the meaning and the implications of who did it and the fact that they did it, which takes the form of this. Elephant now sees, doesn't have anything on its leg, or still just a piece of twine, but either way, not stuck anymore. Now it needs somebody to come along and say, how long you been like this? Now, of course, that could be the very first question, but now elephant's free. Say, so how long's that little piece of twine been around you? About 20 years. Why? Or let's say 10 years. Why? Well, I thought, okay, you thought, and I'm not faulting you for that. Didn't anybody around you tell you that? Well, no. Why? Because if they told you that you could leave anytime, then they wouldn't be able to use you. Do you know what the guy, when he climbed up on you and had you turn right and went to go get more palm trees, and each day you were just lifting these stupid palm trees and then had to stand there all night again? That's where you stay. Do you know why he had you here? Do you know why he never told you? Or he actually tricked you because he never thought you'd figure out it was just twine and a little steak? Because he was using you, and he thought you were too stupid to ever figure it out. So deep down inside, he sort of got a kick out of this whole thing, that a little tiny 120-pound guy was controlling a what? Something that weighs the size of a minibus, and could take him by his throat, trunk, and fling him. He kind of thought you were stupid. How does that make you feel to know that he thought you were too stupid to ever figure this out? And he kind of just used you, and he was going to keep using you, even though you could have left now at any point in time. Switch to the POW camp. Everybody comes out. If I were in that camp, same with the therapists in the camp, as everybody's coming out, it would be the same conversation. And I would say, Does it feel like the Nazis just left? Surprised you, right? How about if I told you they've been gone for 15 years and they just didn't have the decency to tell you they were leaving? They played mind games with you and they thought you were too stupid to ever get. As a matter of fact, they were high-fiving each other, chuckling how stupid you are because now you guys are stuck, but they got out of Dodge so the Allies would never find them. What do you think about some people that would do that like that? What I'm going to start to do, if I'm with the elephant or I'm with POWs, is I'm going to start to help the meaning and the implication sink in, which is going to trigger the flip side of hurt is anger. And what they want to do is the same thing what the elephant's going to want to do, to the extent that he's willing, is once an elephant or once the POWs finally figure it out, what they need to do is venting before they go. They need to go in and trash the joint. That elephant who's been staked right next to, who's had to be out in the cold while the master has been where? Okay. That elephant needs to flatten that house. Yeah, I'm not advocating that all of us go right now, but what's the elephant going to be doing is he's going to take that, that door off the hinges. And as he's slinging stuff each time, and with each stomp of his foot and each fling of his nostril, he's going to be saying stuff. It's going to start slowly because, of course, this is new. Like he knew he can't go on that porch. All of a sudden he said, and I'd say, go on the porch. Like, you know, see that timber that's holding up that overhang? Grab it. And I don't want you to tell Mikhail or whatever I made up a name. Tell Joe, go screw yourself. Rip that thing out. Make him feel like what it's like to be hit by a stupid stick. What's going to happen? The process of getting in touch with his anger, we go from a trained elephant, a domesticated elephant, to a bull elephant, to an elephant that is an elephant. And now, wherever he goes in the line, he has a choice. Now he's joining the other elephants, but he's not going from one cult-like situation to another. Now he's among elephants, but he can do his little elephant roar. He has a choice now. He can actually say, you know what, I don't want to be in number 4. Today, I want to be in number 2. Is that okay with you? No, you don't want to. Okay, let's negotiate this. Because at some point in time, I'd like to be number 2. Now you got to fight me for, okay, whatever. Well, okay, meet me here. We'll go negotiate this in whatever way elephants do that. Meaning, but at least he has an option and a choice. And if they say, nope, sorry, number 4 or nothing, you know what? Thanks. But you guys go on ahead. I'll see you around someday. He's alone, but guess what? He's free. Or maybe he meets a tribe of only 2. So next time at his Thanksgiving table or Christmas table, he used to have 20 people around the table, but now he's just got, or 20 elephants, now he's just got 2. But at least he has very respectful and decent elephants that they actually enjoy each other. So now he's free. So before you finally believe you're free and give the semblance of free or tell someone that they're free, just what you want is you want them to sense the incense. They want to be, you want them incensed because now they know what they had the right to, what they have the right to, and the extent to which they were ripped off. Now they have rebar in their spine. And now, like Carrie Elahe, what did she do on your recent podcast? She's shown a picture of her perp.
And name the names.
Name the name. Right now, it depends each person's situation. You can't get stronger than that. She's trashed the POW. She's out. Ain't nobody putting her back in. Ain't nobody going to give her a look. Right? If that guy were to ever see her again, and he goes back in the same mode or gives same look, or guess what she's going to do? She's going to go F yourself. The chains are off.
She had said on the first episode that I did with her, she said, it feels like they honed a really sharp weapon and now it's pointed at them.
There.
Like,
the hunted becomes a hunter. Absolutely. They need to worry.
Yeah.
They really need to worry now. Okay. And whoever's working with her, whoever the therapist is. But you know what? If we're grounded in truth, any of us, the Lord's going to protect us. I'd rather be rooted and grounded in truth and walk in truth and know that the Lord says his angels about us. So whether survivor or the therapist that's working with an SRA survivor or MK Ultra. So Carrie is a great example of someone who in terms of coming out of the prison camp, it's done. Now, there's the residual stuff, the very normal stuff. But as far as would anybody ever be able to snap their fingers, whatever way, right? Using that as an idea, give them a look. Would anybody ever be able to trigger her again? All things being equal, no. You don't, right? Could somebody hold up a picture of their perp and do what she did prematurely? Yeah, and that's why, number one, you don't want to confront someone out of your hurt. You have to do it out of your healing. And the healing will come when you're good and angry, but not reactively. I mean, you're going to feel the rage and you allow that to empower you so you have your voice, so you have a choice. If you have to go and kill them, now it's reactive, right? You stay with that anger, let it do its healing. And the one thing you're going to demolish is the strongholds, the prisons they put you in. So that's part of that end process as well. That's what it's going to look like. But as far as the programming, triggering, whatever terms we want to use, it carries a very good example. The primary change, it's all off. Now she has the normal, and she's been doing that already. But she's come out of the prison camp, the prisoner of war camp. And that didn't happen overnight. And part of that is she forced enough truth, as it were, and forced enough of her internal system, I mean, the parts, to see it. Because I don't know that, I haven't answered this question. Maybe if I ever get a chance to ask her a question, it would be this. How long did it take and what was the process of you getting truth down? But it did its work enough. So for any survivor, right, you can kind of see where they are in that process by the extent to which they can have a choice to either do or not do something. And that's true for any of us, by the way. So if there's somebody here that, let's say, isn't somebody listening that's not an SRA survivor, the question is this: we're coming up on the holidays. It's going to be Christmas. Are you looking forward to whoever you're going to be with at Christmas time? Are you really looking forward to it? Some people are. Some people are fortunate enough. A lot of people, okay, my client load goes, my phone rings more often as it gets closer to the holidays. Why? Because people have to get around family. They've been able to avoid them till the holidays, right? Compulsive eating goes up in the holidays. Why? Because people have never tasted that food and they can't have access to that kind of food year round. No. They're keeping stuff in their mouth, whether alcohol, food, so that the truth doesn't come out. It's really true. They're shoving stuff. You watch somebody get near somebody, that one relative, it's like, oh, Uncle so-and-so, especially if there's a perp. But let's say there's not just a perp. It's that obnoxious brother, or that one sister, the dad or mom. So you walk through the door, it's okay for the first 30 seconds or 3 minutes, but then it starts. And it's like, oh, it feels so familiar, right? You go back to those family dynamics. And before you know it, even though you've psyched yourself up, told yourself it's going to be different this time because you said, well, okay, I even know I'm trauma bonded, but here's how so I'm trying to tackle a deep issue with the cognitive behavioral thing. I'm just going to tell myself I'm going to be strong. I got my rubber band around my wrist, and I'm going to I've got my behavioral techniques, and I got my 3x5 cards with positive affirmations. So when they bother me, so I'm armed. I'm armed to the teeth. I've got all my tactics, all my ways of my tactic, right? The things I'm going to implement. And then it happens. And then I plan for every contingency except for, oh, my brother is going to be here, and now his girlfriend. And I don't know. So all of a sudden it's like they start, no, I'm okay for about 5 minutes. And then because they didn't get a reaction out of me, there it is. Now it's lasting longer. And now I didn't anticipate, oh, they really do like getting a reaction out of me. So now that didn't work. So now they're going to shift gears because they still haven't gotten a reaction out of me. I thought I was prepared for a certain level because that's where it's always been before, because I always caved in or did something at that level. But now they're going to start doing something to tweak me. And I told myself this time and my therapist, okay, here's my contingency plan. I'm just going to walk out of the room. I didn't anticipate he's actually going to follow me and carry on this conversation. So I'm now going from the living room to the dining room, and now I'm going to the kitchen. And before I know it, somebody else has picked up this conversation. And so he's saying what he normally says, but now he's kind of doubling down on it. And there's the food of choice. Alcohol of choice. So what am I going to start to do? Oh, there's the chocolates. Lay's potato chips. And now as they're talking, I'm just starting to do what? I'm dissociating in my food. I'm binging. Anything to keep truth down. Because truth now is connecting. The flip side of her is anger. So the anger is coming up. So ultimately, again, only the truth is going to set me free, but it'll be in that process of finally finding my voice and finding out that I never should have had to be subjected to what I was subjected to. But I can finally figure it out now. And now I become their worst nightmare.
That's how we take our power back, John.
Absolutely.
Yeah, it's so fascinating, even reflecting on this as, and I'm sure other people can relate as somebody who's not a survivor of these things, to just ask that question that you did. Do you enjoy the people that you're around in general? Like how many instances, whether it's at work, do we like our coworkers, the people that we spend time with, the people, whoever it is, family, how many instances are we where we're just like, oh my gosh, I don't want to go here. I don't want to do this. There's a lot of moments in life, I think, for people that they experience that. And so I think a lot of people are held captive in a sense by limiting their, or I should say maybe enforcing boundaries harder. I know not everybody can just go quit a job that they don't like, or, if you work with coworkers that you don't like. And honestly, it's hard to find, a corporation or a work setting where maybe you're going to like everybody. But more often than not, like how you even said with the holidays, how many people are like, oh, I can't wait to go to work. Yet we spend 8 hours a day there, at least, a lot of us. So, it's like those things I think are really good to consider, because I think if there's ways that you can get out of that chokehold and realize that you're just tied to a little stake that can easily rip out of the ground, might be a little bit tough at first. You might have to tug it, and it might be, somebody might have hammered it in there. But I mean, if you can get eventually a job that you love, or work with people that you like, or if you don't have good relationships with your family, just getting courage to say, hey, I'd like to spend time with you, maybe alone sometime, but being with the whole family just really stresses me out. Like I need to protect myself. I won't be able to come to Christmas, but maybe after Christmas we could spend time one-on-one, and not with the whole group setting, and maybe treating the whole family like that. However it is, but I think there's a lot of instances where we're tied to that little stake, and we're just continuing a pattern that doesn't feel good with us. and we don't realize that maybe there's other options or ways to go about it. You made me consider that with a lot. And I'm like, gosh, I'm pretty lucky that for the most part, I have moved my life into places that like I do look forward to going to work. I look forward to doing this stuff. There's a lot of things that I look forward to, but there's also instances where I don't, and you have to realize, at least for me, when I get those feelings, it doesn't feel good. And it's something that I think when we don't feel good, we should change it. And many of us don't. We just keep reliving it.
Yeah. Yep. Emma, I'm inclined, although I've got a lot more material. As a matter of fact, we had sort of anticipated looking at even more specifically some of the stages, some of the indicators that, okay, I really am experiencing this. This is real. And then some of the stages. Why don't we save that for next time?
Okay.
And we'll go through that. We've got some things to illustrate that, including one drawing of an internal system, and that'll be good. We can walk through that. So we'll walk through what are some of the indicators that you really do have if somebody has parts, and then how to begin that process of getting in touch with those. What are the stages of therapy, and then where do you begin in stage one? So kind of what are the stair-step fashions, because each of those broader stages, there's probably about 4 stages, have then a number of separate stages. So incremental. So it's like, how do you get across the US? We can probably do that in 3 to 4 days, let's say 4 days, but how many states are we going to travel through? So in each state, this is what we can anticipate during the first leg of this journey, that kind of thing.
Yeah, let's do it. I love where these conversations go. They're super organic, and I like they're all sort of building on each other, but they're separate at the same time. But all of these episodes that we've done so far, they tackle like really deep things that we're not really given tools growing up to consider. There's ways that even if you haven't, like I said, been through extreme abuse, that like we're all still trying to break free from, even if it's just what we see on the TV and taking that in, somebody telling us something bad about ourselves, and all of a sudden it's an identity for us, eating because we're trying to actually stifle saying something, so we're stuffing more down, like all of this is really fascinating to consider. And I love this conversation tonight. There was so much gold in it.
But before we go, what I will recommend, and you were kind enough to screen share, between now and next episode, I'll give people some homework. No, I'm kidding, but might as well.
Yeah.
I would recommend that they go to my site, not because it's my site, but just because I know it's on my site and the reason why I built it or put it together. Okay, this is one of my sites. Recommend go to survivorsupport.net. I'll do an unashamed plug if anybody ever does want to make a donation, but that's a separate issue. But to the extent that we do have donations, we can help people. I really do give away a lot of free therapy, so that actually helps. Okay, that's my only
you're doing
plug.
A lot for free. Never feel bad for offering for people to donate to your ministry.
But if they want to. Okay. So aside from my little plug there, I recommend you go to the podcast tab. So here we are in the site. Go to the podcast tab, click on that, and what you're going to see is Journey to Healing. As a matter of fact, I'll go back to the home tab for a moment under About. And if you want to watch it, where to go here? I'm sorry, just the home tab. Okay, so that's the home page. This is Ken McClinton. He is the CEO of TECN.TV. It's the leader in internet TV. That's my radio voice. Okay. But he kind of talks about me a little bit there. If you ever want to tune in live, you can click right here if you forget the name of the station. So 8 to 9 p.m. Eastern Standard Time. So that's on a weekly basis. I have tried to capture all the programs and put them in a repository. So that's under the podcast tab. I'm probably about 15 programs behind getting them up, 8 of which have to do with, probably 9, the series that I'm doing right now. So here would be my homework assignment. The second would be, so both have to do with listening to these programs. I'm doing a series on forgiveness, what it is versus what it is not. I just posted, I don't think it's on this page yet. I will put it on here. I've just posted my part 21. Okay, there's going to be about 50 parts. So if you want to find out what I believe, and that's why I'm being so comprehensive, hence right now 21, so we've got 20, but tonight I will put up episode 21. If you want to find out what forgiveness is versus what it is not, especially from a biblical or Christian perspective, start with number one and work your way through it. Okay, it just takes a lot, really, unfortunately, to unpack and disarm the greatest lie out there, which is you have to forgive everybody no matter what, because God did. He did not. Okay. How can you say that? Well, I've got 21 parts now. So start and see, come and talk to me after part 21. I mean that in all sincerity. If you have any questions, and by the time you get to 21, we're going to be up to about 35. I'm really careful, and you will see that. So there's 21 hours worth right now. Okay. I have 8 I haven't been able to put up. So I can tell you there's going to be about 50 hours. Okay. So take your time, go through that. I think that'll be life-changing. The rest, okay, and you'll be able to, there's one about sex offenders. That's just somebody asked a question one time, what's the likelihood? Okay. So if anybody wants to know about my work with sex offenders, why put that up on this? Because I also want survivors to know that it wasn't about them. Again, that's why I have it here. This is the only thing aside from the insights tab. But once the background changes from this kind of blue to purple, you're into the original, and I will pick up where I left off after the series of forgiveness is finished. This is really, if you scroll down, now you can see how many. This is really 2 years worth, pretty much. This is going to go on. The series on boundaries is going to go on for a couple more years. So I probably have, I don't know, right there, maybe 75 hours worth. I don't know how many episodes, I forgot. What I recommend is this. Start all the way down here at the beginning and methodically, there's Mother Gothel, right? You can say there's Tangled, okay? So start methodically, look at 3/26/21. Okay, so almost, well, I guess we're going on 2.5 years, almost 3 years. Okay, start methodically and work your way up. And I tell you what, you've got free counseling in a nutshell. And it's each one is a standalone, just like these that we're doing, Emma. But they really, if you want to get the most out of it, ready? Start going one by one by one. And I'm convinced of this. If you listen to every single one of these in successive order, now what you'll find is this, it'll link to my YouTube channel. That's kind of busy because I have a smorgasbord of stuff that I deal with. I recommend this. Just keep coming back to the website, because then you'll be able to keep track of the ones that you went through. Okay. Watch every single one. And I'm convinced that you will be so much further along in your healing. Okay. So it's all about boundaries. It's looking at what happens. Right. And this was, I interviewed a gal. So this was kind of a standalone one about domestic violence. Right. So just every one. Why? Because there's 2 primary issues. So there's emotions, what happens when they're stuffed. Okay. We deal with pigs and dogs and fools and reprobates and all that. Okay. So do yourself a favor and spend time. This is free therapy. Okay, it's at your disposal. And see if I'm not correct. I'm going to say that this is probably going to be some of the best stuff you've ever heard. Not because it's, okay, I've got a little ego. No, but I just work hard to really consolidate what the key issues are. And since in my estimation, all of counseling, so we got, say you see the word boundaries, it keeps coming up time and time and time again. The 2 issues that any counseling issue ultimately, or counseling experience ultimately should deal with is this. Now I'll get out of this. Okay. Is this. So even if you're a survivor, you're working through all this stuff, it still boils down to 2 primary issues. Okay. It's grief and loss, meaning, have I been able to leave the past in the past? Well, someone that's a survivor, the past is controlling their present, because it feels like you still have to be dutiful. So remember, you're still in the prisoner of war camp, even though the perps have left. So the grief and loss, the grief and loss process hasn't been able to happen. The key to that, by the way, is anger. So the two issues every counseling situation should address. So the good news is this: I don't care if you have depression, anxiety, panic attacks, manic depression or bipolar, what they call it, right? So just shy of an organic issue, I'm telling you, I know what your issue is. Not because I'm bright, okay, but no, here it is. First of all, the verse that applies is this: the last two verses of Psalm 139. This will be the process for you. So this is a prayer to pray as you tackle counseling, you tackle your issues. Lord, search me and know my heart. Right, the subconscious, unconscious. Lord, search me and know my heart. Why? Because there's a part of me I can't get at, because if I could get at it, I would have already gotten at it by now. Lord, search me and know my heart. And here are the two issues that will be summarized in the other two issues we'll talk about. Show me my anxious thoughts and my hurtful ways, and lead me in the way, or lead me back in the way everlasting. So anxiety, and now I know what we talked about anxiety, that's really adrenaline, but for the sake of that verse, anxiety and ego, those will be the two things that'll mess us up, pull us off the path of life. Okay. If I go to counseling, if I voluntarily go to counseling, it's because I am in that first category. I have anxiety, that's what I'll feel, and depression. So once you're in counseling, the two issues that you will ultimately need to tackle, you're going to look at the past to make sure the past is resolved. We call that healing. All right. So every trauma survivor ultimately wants to be able to have the past be in the past without dragging it into the present. So you want to make sure that the past is finally settled. It's in the past. That is trauma therapy. Then the other issue is, and this will be the primary issue 100% of the time, boundaries. So the two issues, and to me, that's good news, right? I can turn behind me to the DSM, see those big, thick books back there. I can either hold it up and say, okay, let's diagnose you. Look at all these pages. We'll flip through them. We'll find out how many, and then we'll help you manage all these disorders. Or how about if I say, there's just two issues we need to tackle, and we're going to start with the first. And the first is your boundaries. Do you feel like you can actually state your preference? And can you go with that? Regardless. That's the first. So the issue of boundaries. That presupposes you are fully emotionally present in the moment so you can figure out how you're feeling. You can figure out your preference so that somebody doesn't take advantage of you, talk you in or talk you out of something, so that you don't walk away frustrated, so you don't walk away with more than one knapsack. So in the here and now, how are your relationships? All things being equal, are they pretty much okay and mutually beneficial and satisfying? If not, then you've got somebody's knapsacks. So one knapsack, no more, no less. You will see that in the midst of a current day, here and now relationship. Am I free to speak my mind, state my preference? That's the very first thing. If you could, you wouldn't be in therapy. None of us would. Okay. More than likely, if I can't do that, it's because something in the past is preventing me. So we need to resolve the past so that all I'm dealing with is the present. Once I resolve the past, it'll be a whole lot easier because I will know who I am. I'm now an elephant that now has left the compound, and nobody can tell me what slot in line in the new herd. I'm free. Get in line. Okay. I've just changed venues, right? How many people coming out of an abusive situation end up in an abusive marriage? We want to prevent that so that somebody can discern in the here and now the beginning of a cycle, the beginning of when someone starts to place knapsacks, because long before somebody has a Stepford wife that he's created, being a perpetrator or a Mother Gothel, how does somebody end up in a tower like Rapunzel, little by little? And it always starts with a knapsack. Now, she kidnapped the kid. You show me someone with one knapsack, no more, no less. I'll show you somebody that has a voice, has a sense of self, has a sense of permission, has a sense of spontaneity, has a sense of hope, has dreams, knows where they're going, feels okay, feels eligible for that, and can enjoy along the ride, but can feel deeply and have connection, but can also go it alone and feel okay. That's not bad. And that's the goal. And that's kind of where we're going. So we'll look at, okay, how do you get from there to here to there?
I'm looking forward to that. This is so valuable, all of this, and just, it's really important. I think that that's how we move forward in this world to make it better, is if we understand trauma in ourselves. We're not taught it. So we really live in an abusive society where we're taking it from all different angles, our government, our schools, everything has just been so inverted. And then the education piece is taken from a lot of us, and we're not taught about boundaries or narcissists or psychos or trauma or dissociation, and so many of us just grow up feeling so broken. And like you said, we might go to a therapist and they're not studied up on this, so they also don't know how to help. And so many of us are on pills and, just all these different things, overeating, so this is, I feel like, breaking that generational trauma and like really getting to the root, all of us, no matter how broken you are or not broken, even if you've had a really great life, still being able to self-reflect and ask how you can be better. Are you carrying 2 knapsacks? You don't have to be carrying 100 for it to be heavy. You could just have 1 extra and it's still one too many, so being able to hand all those back to where they go, and like you said, have that one, and be content on where we're going, and be firm on our boundaries and our beliefs and ourselves. I think that that's how we heal the world, and we're going about it all opposite. So what you're doing is so important, John, putting all this free content out, all these free videos, all these interviews that you're doing, all these different projects, these websites, these different causes. Thank you for that. It's so valuable to have that. You could easily charge, an arm and a leg for every single thing. And, you deserve money. Like, we should all be resourcing you. And I encourage everybody to go donate to you instead of all these corrupt organizations that everybody's throwing their money at every year. Go right to somebody who is actually doing good things and giving free stuff to us. But I really appreciate what you're doing, because it is going to help move the needle forward. It's something more and more people are going to need as they start becoming more self-aware that the world we live in isn't the world we grew up thinking that it is, and that there's so much more to learn about who we are, how our bodies function, how our minds function, how it's all integrated, so I just want to commend you for your work, because you are so tireless. I mean, you're up late right now working with me. People don't know that watching this, but it's really late where you're at, and you've had a long day. You work with clients, you have these groups that you work with, like, you're doing your own podcast, making your own content. Like, you're all in on this, and it's amazing. And so I really want to thank you and commend you for everything that you're doing, because I know it's going to make a big dent in the world. And I know that your work is going to be increasingly more and more important as we move forward.
Emma, thank you. And likewise, I'm thrilled that people are learning about your podcast, and you are selfless. You're featuring all sorts of people that can be resources. So I'm thrilled to be able to kind of partner with you, right? And we'll just continue, as you've mentioned, that maybe we'll create a little series here, kind of overview of therapy to help people understand. So I think it may be the right thing at the right time.
Same. And let's tell people where they can find you.
There you go. I have 3 primary sites. Then I also have a blog. The first is survivorsupport.net. All of these are scrunched together, no space in between the words. And that's another one right there, right? Sorry. Okay. So survivorsupport.net, that really is simply just a resource. All of these are resources. But the theme of this is to help survivors do their own therapy, quite frankly. Other than the podcast tab, I don't have many of my own videos, and I'm actually going to put ours up under probably help for the journey. So I'll tell you where those are going to be, but these are virtually all videos, so that it's very user friendly. Insights, it used to just be one. Now it's two. I had to split it because it got too big for the little engine or search. I don't know, whatever powers this whole thing. So I really recommend if somebody wants to move their own therapy along, start under Insights 1. Just start with the first tab, emotional pain. Read all of those, then go to the next one. Go to the next one. There's a lot on there, so you're not going to run out of things to read about. By the time you're finished with this, and then you've got all the podcasts, you're going to have a lot of insight into figuring out who was responsible for what. That has to do with the knapsacks. So that's the goal of this site. So survivorsupport.net. My training site is, I haven't been doing too much training just because of things as far as things I'm doing, but this is a training site. This was my first training site, is churchprotect.org. So all scrunched together. There you go. I have done trainings in the past. Those are still available if anybody would like to. It's a little more expensive, but I do that so that churches or organizations really partner together in a community to ensure they can protect the flock, because perps will go from one church to the next. But if you want to find out myths, a lot of this comes from my work in the prison system. So you can go on there and you can just start scrolling down. So there's a whole list of myths, meaning this is what we've kind of come to learn about predators. And so I correct those, and then I have truths. So under the truths tab, you're going to find my work in the prison system and my pre-published research. I'll just put it that way. So I have on there really emails, so professional peer review of my work, because I want people to know. Why should they listen to me? Why should they trust me? So if you scroll down, I don't know many people that have actually put their own emails. So here's some feedback I've gotten from people. There's a neat one from a doctor that has headed up a research lab in Stanford. If you scroll down just a moment, you will be able to, right there. So Dr. Williams, it's neat because scroll down just a little bit more. This was such a nice thing. This was unsolicited. So she talks about how my emphasis on intuition and discernment, you can see that last sentence, fits with some of her brain scanning work on non-conscious brain circuits. So that was a neat thing. So I have, a director and professor from Stanford, right? Precision mental health and wellness. Dr. Judith Riesman, she did the primary unmasking of Kinsey, and then the man who started WikiLeaks. Now he's not with it, but Larry Sanger, that was neat. That was a number of years ago. Before I know it, and that was before I got kicked off of Twitter when it used to be called Twitter. All of a sudden, out of the blue, he's an extremely bright man. So that was a neat thing. So in the beginning, I just have some people that have reached out to me, giving me feedback. So that's a neat thing. But scrolling straight down, eventually you will see actual emails I have received. It's a little bit further down. But just so you know, John, why should we listen to you? It's one thing to have peer reviewed, but if you keep scrolling just a little bit further, you're going to then see actual emails. There we go. So that's going to be the very first one. So I want people to know that I haven't just made up my background. So, people, the perps, the naysayers will say, Uhler's never been published. He has no peer review. Okay. As a matter of fact, I'm going to go one better, because peer review is usually academics that aren't in any particular field. They got a doctorate, right? But they sit behind, and I was an adjunct professor for Geneva College. So I have worked in academia. It's a whole nother ballgame to be in the field, especially working in a prison system. If you're an academic, if you're going to research perps, you're going to have a few hours, maximum about 3 days with them. You have to get permission to go into a prison. To be able to have a set of keys and unlimited time to spend behind the scenes with people that have done heinous things, and to get behind their mind and research. So that's what I've done. So you'll see a lot of different actual emails, and then pieces from my blog. So that's churchprotect.org. unmasking the trans movement. This is a recent thing, but I felt compelled. So Brad Wilder, my beloved host, just suffered a heart attack about 8 weeks ago. We put a lot of things on hold. We'll start back up slowly. We have the same YouTube channel and BitChute by the same name. So all our videos are there. Dr. Ann Gillies is my co-host, but there again, we have interviews from subject matter experts as well as parents. Right? We have a detransitioner on there, but again, you're going to find subject matter experts. And unfortunately, we've been so shadow banned that I don't know, we have 325 followers. Whether I was putting this together or not, this should have over 1 million just because of the content. And if you want to find out, click on those. Those are 30-minute episodes. We have over 100 of those. So there's a lot of information on there. We have, I don't know, 135 subscribers. So this is just public service. So we're really shadow banned. And then the very last one would be my blog. That is survivorsupport.us. So again, these are all resources. Is that, yep, and that's how you can get to it as well. And going through this method through on my website, this will bring up the most frequently visited per hits individual things that I've written. But if you go to the site itself, you'll have the option. But these are things that I've written. This is the one about trans, but then the majority of them, everything else pretty much, is going to deal with predators and perpetrators. And then, of course, my own YouTube channel. So you have my blog, you have 3 sites, and there's my YouTube. And so there's a wide smattering. You're going to see the same videos for forgiveness, right? Because again, under survivorsupport.net, under podcasts, right? I first publish it on YouTube, then collect those. So if somebody doesn't want to have to keep scrolling through, because you can see kind of in order what I'm working on back and forth. That can be confusing if you want to methodically go through the series on forgiveness. So if you want to be methodical about those series, I recommend going through survivorsupport.net. But a lot of different things you can see I've been working on. So there you go. Those are going to be the different resources.
It's so neat seeing everything like that you're doing. Like I said, I love like all the different ways that you support this community, and the trans movement's one of it, and it's something that not, a lot of people are talking about. So everybody, I really encourage you, John, like I said, he's giving away so many hours for free to you guys that he has invested his own time in, that he could be making a ton of money from, and he's helping you. Especially, I know a lot of people that listen have told me too that they can't afford therapy right now, which I get, but you have somebody here that's trying to solve that problem for you by giving you some tools that in the meantime, while you save some money to maybe get somebody and get some help in the future, you have hours and hours and hours and hours of videos that you can go watch and start, get a little head start, a big head start actually. So I love that you've done all that, John, and that you have all these different platforms and all the ways that this passion shines through you. You're such a light for people who have had just such bad experiences, and it's been a blessing for me to get to meet you too. Like I said, I prayed for people like you to come into my life, because I didn't have an answer for people who had all of these complaints, and it was really concerning for me too to hear, gosh, how is this whole industry that's designed to help people so far behind? Like, how do survivors know more about how our bodies and minds work than people who are paying hundreds of thousands of dollars to get a degree to do it? It's wild. So the work that you're doing is so important, and it's so relieving to know that there's people out there like you. And it gives me hope that there's even more people out there like you that maybe just aren't as public, and that hopefully there's people watching you who are taking notes and saying, gosh, I want to model my practice and how I'm interacting with my own clients, like how John is. So the work that you're doing is so important. You're laying such an amazing foundation for your whole community and for the survivor community, therapeutics and survivors both. We need strong men, strong therapists, strong counselors, strong advocates like you know, on the front lines advocating for this, because, you know, if somebody like you doesn't and nobody else is, then who will? So I encourage everybody, go follow both of his YouTube channels. I'm going to have them in the show notes. Go check out all of his websites. There's so much information, whether it's video or stuff that he's written on his blog. Go check that out. Go donate to him. We want John to be able to keep doing this. I'm telling you guys, podcasting can be expensive. The equipment is not cheap. The platforms that we use are not cheap either. A lot of this comes right out of our own pockets, which we're very grateful and happy to do that. But it's also nice if we're resourced. You know, the government's never going to pay us to expose this stuff. So, you know, we don't have careers doing this. It's something that, you know, we're paying for out of pocket. So every little bit helps, you know, and especially a lot of us are so conditioned to go donate to, you know, to nonprofits and these different organizations that, you know, we don't know where the money is actually going. So I always say, if you have $5 extra, if that's in your heart and you want to give to something, go right to somebody who's right on the front lines and you know exactly where the money's going. So I'm going to have all of that in the show notes. And is there anything else that you wanted to wrap up with?
Just maybe again what we'll cover next. So what can people anticipate we'll cover next, which is really reviewing what are the symptoms if somebody still hasn't connected with the fact that they've been traumatized. So we'll look at a pretty comprehensive list of symptoms, and then we'll look at kind of where to start. So the beginning of, we'll just call it stage one. Okay, so we're going to head off on our journey across the continent. What can we expect within the first day's journey as we cross these different states? So we'll figure out, okay, where do you start with this whole thing? And so that's really enjoyable. No, I'm not minimizing it, but just for me to be able to help someone begin to understand, okay, there's a process and here's a process. And that's a neat thing, because then the person can begin.
Absolutely. I'm really looking forward to that. And this was an amazing conversation. I'm learning a lot from this. I know everybody else on the other side is. You guys listening, again, go connect with John. I'm going to have everything in the show notes. I'll have all my stuff in the show notes. Try to connect with us on all platforms. It's always iffy on if some platforms will eventually delete us or terminate us. And I don't want to put that, you know, in the air. And I ask you guys to say prayers over all of these channels and these pages and these missions. But I encourage you guys to go follow us across multiple platforms, just so you can keep in touch, just in case, you know, so we can all stick together through this. So you guys go connect with John, connect with me, reach out if you guys have any questions. My email is below if anybody wants to reach out about sharing your testimony. Reach out to John. Like he said, he makes himself very available too. So you guys, thank you so much. We couldn't do this without you. God bless you all, and we will see you next time.